И сядет просто. Ого, ничего себе, добавят, да? Очень классно, да. Как включить это все? Или включено уже? Давайте я сейчас спрошу. Горит, да? Угу. Раз, нет, не слышно. Угу. Раз. Угу. Дорогие друзья, коллеги, участники нашего форума, который проходит ежегодно. И сегодня у нас сегодняшнее событие, оно явится, надеюсь, очень эффективным и плодотворным для всех, кто участвует в сегодняшней деловой программе. Наша деловая программа состоит из 3 сессий, на которых выступят эксперты медицинского и оздоровительного туризма. Также мы с вами сегодня услышим и зарубежных наших гостей, которые тоже приехали издалека и будут представлять свои доклады. Мы послушаем и научно-исследовательские работы наших удивительных медицинских учреждений, которые будут представлены сегодня здесь на первой сессии. И сегодняшняя встреча говорит о том, что медицинский туризм, он очень активно развивается, набирает силы. И, конечно, Санкт-Петербург является удивительным городом, который имеет огромный потенциал для развития медицинского туризма. Сегодняшняя... Извините. А слышно меня было до этого? Да? Не буду повторять. Спасибо, хорошо. Сегодняшний Петербургский экспертный форум по медицинскому и оздоровительному туризму, который проходит у нас здесь, в экспофоруме, является таким знаменательным событием в развитии медицинского туризма. И, конечно, первая сессия, которая называется «Синергия медицины и туризма. Возможности и перспективы». Я хочу предоставить слово, приветственное слово замечательному заместителю председателя Комитета по развитию туризма Санкт-Петербурга Юлии Александровне Кузенской.
Спасибо вам, Светлана Викторовна. Так приятное утро сегодня начинается. Добрый день, уважаемые коллеги. Рада сегодня вас всех видеть. И действительно, наша сессия сегодня уже, наверное, носит традиционный характер. И мы продолжаем обсуждать развитие медицинского туризма, влияние медицинского туризма, вообще, о чем это медицинский туризм.
Medical tourism is relatively new.
Но, тем не менее, для нас это является одним из приоритетных видов развития туризма. И вот сессию назвали «Синергия медицины и
tourism development». We titled this discussion synergy between medicine and tourism, and it's something that we didn't do by chance, because this is a real synergy. Tourism comprises many branches, and according to the opinion of experts, approximately 53 branches are merged in tourism as an industry. This is something that is involved when a tourist comes over to another place or country. And in medicine, we also have great number of branches and specialities and fields. And when we have this synergy, this fusion of the two, we can see even wider character of this concept, of this notion. Why tourism and medical tourism as part of it is of interest to us? I suppose that from the viewpoint of business, the mean check of the medical tourism is tenfold as high as the usual tourism. He stays in the city much longer. But nonetheless, even if a person comes over for certain interventions, for certain checkups, or some examinations or tests, he can spend his leisure time, free time, doing sightseeing and enjoying himself in the city. St. Petersburg is a touristic capital of our country. Everybody knows this, and I suppose that we can maintain this status. And this is an international capital of tourism, I would even say. And we cannot but utilize this opportunity, the opportunity of this city. But also, I would like to mention that St. Petersburg is a motherland of medicine. We have great number of tertiary settings, highly qualified physicians and doctors, as well as wellness organizations and settings, because we speak not only about medicine and providing medical service, but also we speak about wellness and rehabilitation centers. I would like to stress it that in St. Petersburg we have a cluster where we have wellness and spa, a resort complex, and after the pandemics, I suppose it is very relevant. And as we are faced with a necessity for rehabilitation, of course, the main wellness and spa resorts are usually located in the southern part of the country, but nonetheless, for the lungs, for those patients who suffer from pulmonary disorders, to restore after COVID-19, I suppose the climate of St. Petersburg is one of the best because it is so mild, and we also have the pine trees, and we also have the coastline, and it's not very hot. And this is something that facilitates rehabilitation and recuperation. In St. Petersburg, we can undergo treatment and then undergo rehabilitation and wellness procedures. All this results in a great opportunity, in an opportunity to develop interesting products and invite tourists to our city. And continue developing this new product, bringing it up to the new level. Of course, there are a lot of components to the process. In hospitality, we are used to having a very hospitable and friendly approach, and we have a separate system and even programs such as like China Friendly. Back in 2019, we had a lot of Chinese tourists, and in Pulkovo, probably you already heard these welcoming phrases in Chinese. Such programs are several. There are India Friendly and many other. And we have a center of competences that was founded back then, and it continues developing in the frameworks of the national project, the development of tourism and hospitality industries. So we are going to educate and professionally develop professionals from different regions of Russia. So we are going to set up a federal center in the territory of St. Petersburg. And if there is a keen interest to our center of competence, we are happy to open the doors of the center to all of you. We will be happy to tell you more about it, because the medical settings, indeed, they actually need it, and there is a question of quality. There is a question of introducing a hospitality component into the medical settings, because this is what is only a starting point there. I'm not going to scold by any means the state-run settings, but nonetheless we must admit it as a common truth that, yes, we have certain lacunes, certain gaps, certain growth points, by means of which we can continue growing, developing, and expanding, and we can help each other. We have certain experience that we can render to you from the viewpoint of hospitality, and if we speak about synergy, we can help and assist the medical settings that I know to invite more tourists, more foreign citizens, foreign patients, and especially to those centers that have already started providing such services at international level. We can actually organize transfers. We can welcome this tourist at the airport. We can provide him with hotels of different categories. And especially if we admit it, when Booking.com left the country, it's quite difficult to book a hotel. Even if I try to book a hotel somewhere out in the regions of Russia, in some remote cities, I wouldn't succeed, but for my friends there in those cities. We have certain expert experience, and we can provide services in this particular area. We have great number of tourist and travel agencies that work with incoming tourists, and they provide all the best service. In Russia, we have the only agency in Russia which works within the development of tourism in Russia. And some regions, by the way, already envy me and start ask questions, and they want us to share this experience with them. Indeed, agencies, they do a lot, and the agency is a shopping window, or a flagship, so to say, company, and then you can attach the other services like wellness, spa, rehabilitation. We are ready to share this experience. We organize different types of press tours. We also organize workshops. We organize roundtable discussions, and different types of touristic packages is something that we're developing at the moment, and we are ready to share this experience with you as well. Medical tourism also is very specialized in terms of personalized product, and we have made an attempt to create a mass product, a package that is easier to sell. Anyway, it's an individual type of tourism, because a group cannot travel for a checkup. But at the same time, we're trying to somehow experiment with this, probably to promote the concept of medical tourism and the opportunities that we have at the moment. And we do have opportunities. We have great opportunities. We have high level of professionalism, and this synergy, I suppose, will give us additional benefit and profit, both to tourism and to medical settings, and also to health centers. I suppose that what we shall hear from experts today, what we will be discussing throughout our working day today, what our experts will talk about, will be indeed very important. You can see that we're moving already towards this synergy. We are moving hand in hand, shoulder to shoulder, shoulder in shoulder, and I suppose that's already a success. Please remember that our doors are open, always open, and we're very happy to get all your ideas, proposals, and we shall probably try to do something about it together. Only working together we shall achieve better success. So I would like to wish you fruitful work and effective discussions. Thank you very much for joining this discussion at 10 in the morning. Thank you very much, Julia. Thank you for such concise presentation, for the welcoming remarks. I do hope that this morning will be very nice and pleasant, and our discussion will be fruitful and informative for all the parties. Indeed, the medical and wellness tourism cannot develop without this synergy between the Committee on the Development of Tourism in St. Petersburg and the Committee on Healthcare. They do work jointly. They have a great deal of cooperation, and they have great number of different events which are organized together by both committees. I would like to pass the microphone to the Deputy President of the Health Committee of St. Petersburg, Alexei Tereshin. Good morning, Good morning, dear friends. Good morning, Svetlana. Good morning, Julia. Yes, now I have my slides on. So today I have a very difficult task. Within 10 minutes, I need to talk about everything that happened within healthcare system within recent 5 years. But before I get to the body of my talk, I would like to express my words of gratitude. I would like to say that we do not have just a formal connections with the Agency on Tourism, but we have very good, friendly relationship with these people. And I suppose that this friendship is exactly the basis of the synergy and cooperation that we are talking about at the moment. The guests of our forum, I would like to welcome all of you, and also I would like to wish you to enjoy the spirit of St. Petersburg autumn, which was referred to by Alexander Pushkin in his poems quite frequently. I would like to welcome you in my city, which is very deep in our heart. Now let's move on to the body of my talk. Yesterday, at the plenary meeting, today is the second day of forum, and yesterday we discussed the issues of what is the cornerstone of the healthcare system in Russia. The cornerstone is a person. The human potential, lifespan, and what is also very important, active longevity. It's not just a figure, some age, but this quality of life is something that matters with good physical activity and good mental status. This is a quotation from Vladimir Putin. Children and family and person is in the scope of our attention. And definitely saving the potential, the human potential of this country is the focus of attention of our state. And longevity, active longevity, is something that is in the scope of our attention, as I've already told you, and we have quite ambitious goals and tasks in front of us. Up to 2030, the mean span of life must reach 78 years. For St. Petersburg, this is the parameter that was corrected. It's 79.1. This is even more ambitious than the mean age for Russia. And I suppose that all the efforts which are being, all the efforts are quite impressive. Even during the pandemic, actually, we saw a lot of gaps, and nonetheless, that didn't hinder our movement forward. So our goal-reaching process, I would like to express gratitude to my colleagues. Yesterday, I enjoyed the presentation from the Building and Architecture Committee presentation, and also from the Environment and Nature and Natural Resources Committee. I enjoyed that presentation very much, and I heard it for the first time from them, that the birds, whether they are comfortable in our city environment, because the birds actually perceive the light differently. So we need to use, not to use the blue light, because that actually, that for the bird, that would mean that the night never comes and they will fly away. So, and if the birds fly away, then the human beings do not feel comfortable, and their mental status or health status go down. So all these are examples of synergy between different committees of St. Petersburg government. And indeed, all these ambitious goals mean ambitious funds. And I would like to show you that we have bigger funds bigger and bigger funds allocated for these needs and projects. You can see that we have approximately 5.9% and is annual surplus in the funds allocated for the goals within the area of healthcare. So you can see the pie graph that shows where we allocate these resources to. And definitely that would mean not only projects per se, but also certain support for specialists, especially the highly qualified staff. They must be paid appropriately, especially within the fields of medicine and education. This is something that is controlled by the federal government, I must admit. And when it comes to assisting and helping the children, all starts with our attitude to children, because all this reflects the system of healthcare, how mature it is. You can see the statistics here on different settings that provide medical service and assistance to children and pregnant women, also delivery and maternity clinics. You can see also here, when it comes to synergy, I would like to mention that our medical cluster is really very significant. You can see that we have 50 federal centers which are located in St. Petersburg and almost 130 private medical settings. Also, there are over 300 city hospitals that belong to the city budget. And we have top centers of the world level, like a federal setting named after Almazov. We heard yesterday from academician Shlichto, who is the leader in the quotation index as a scientific and research center and platform. And also I would like to say that the technical base and equipment are improved from one year to another. The Maria Magdalena Hospital, or the hospital named after Maria Magdalena on the Vasilievsky Island, was re-equipped not very long ago. Nephrology, cardiology, and also there was a separate section which was devoted to it yesterday. We had good projects in a number of pediatric clinics. For example, one of them is in Aviakonstruktorov Street. Again, it's going to be completely re-equipped with over 1,200 beds. And when it comes to wellness and rehabilitation, as well as resorts, it has already been mentioned, but generally speaking, in our city, we already have quite good wellness and recreation settings. The whole district of St. Petersburg is called Kurortny, which means wellness. In English, we have all possible types of settings, facilities there, and it's a brilliant wellness and resort area, which is located by the sea. We also have the porcelain baths, for example, which was used long ago by the imperial family of Russia, by the way. This type of facilities continue developing, and pediatric direction is something that we enhance in terms of re-equipment and development. So, also I would like to mention a couple of words about a breakthrough project which started this year by the government officials as well as the medical geneticists. We are speaking about orphan diseases, the so-called orphan diseases. These are rare disorders which are very difficult to diagnose because they're so rare, and they require a great deal of funds and financing, as they need to be treated definitely.
Testing for newborn diseases during 2 days after birth is carried out and is conducted and done by to 99.9% of newborn ladies. It's a budget-supported financing. All these tests, they are carried out to all the newborns of Saint Petersburg. It's a federal program. One smear of blood from the heel of a newborn baby, we can diagnose up to 100 diseases. If we start to treat these diseases very early, we will ensure very low level of traumatism. For example, the spinal muscular atrophy. It's a very expensive treatment. One shot is about 130 million rubles of value, but this injection, if it's introduced very early, will allow to stop invalidization and disability. Otherwise, the person will be disabled and can't take care of themselves. Here on the slide, we can see the network of different medical establishments. First and foremost, our medical genetics center that under the federal program, it was re-equipped by state-of-the-art equipment, and we capture the whole north and western region of our country. Testing of orphan diseases, it's one of the directions, but the second area of our interest, and the President supported this, to create the fund, to establish the fund that is called the Circus of Wellness, the Circus of Trust. The great amount of money is allocated for these children. They are treated by the federal budget. To understand the scope of the situation, 357 children that are in the register of these orphan diseases, and financing of this year financing is higher than 3 billion rubles. 100 million rubles we spent to prevent disability of these children. This enhanced neonatal screening, this is our map, roadmap, how we work in our center and with the northwest of Saint Petersburg. The saying of the head of our government that says that each life of every child is very important. We are facing a demographic problem. Up to 2030, we are going to see the downfall of their birth rate. This year, the number of abortions decreased twofold. It's a very good tendency as to the increase in the birth rate. A very important point of our work is the modernization of the primary care establishments. Unlike the theater starts from the cloakroom, here we can see how everything happens at this level. A huge amount of money is allocated. It's a very money-intensive project in the Russian Federation. For the reference, I'd like to say that in 2022, from different sources of financing, 4 billion rubles were allocated. 87 medical establishments, they were either reconstructed or built from the scratch. The city is growing up, expanding very intensively. 1.8 million of our residents, they acquired new housing, they moved in the new housing. The infrastructure is booming. To make their primary healthcare centers close to the residency of our residents is very important. 1,267 units of medical equipment up to very modern we purchase every year. We can see this logo, SMILE. It's our integral style for the specialists from medical care. And it's true for everything, for our medical costs, for equipment, and for other things related to medical care. In the beginning of this year, we opened up a new center at the level of the very modern hospitals with the swimming pools, with the very short waiting time. Maternity hospital number 10. We realized the program there when a mother with a number of children, the mother is in the center, and our workers, they take care of the children of this mother. I'd like to speak about highly technological care. We mentioned this in all the sectors of medicine. At the top level, everyone can receive this medical care. A few words about medical rehabilitation. I can't say about this. I've been rehabilitologist for more than 20 years. Now I follow up this sector of medicine and our committee. In our country, the program has been realized that is entitled Optimal Environment for Remediation and Restoration of the Health. It's a medical rehabilitation. Financing 200 million rubles the previous year from the federal budget. Now more than 80 million rubles from the federal budget. Everything is equipped of the robotic equipment with the use of virtual reality and artificial intelligence. The prospects are very serious. Up to 2030, all the medical establishments that participate in this program will be re-equipped by modern equipment, and parallel the program of the retraining program of our medical professionals is going up. We have the program, we have a new medical specialization, medical rehabilitation doctor. I can't but say about the very important aspect working about organ transplantation. Even pandemic couldn't stop this tendency. Historically, we have 154 transplantations. I am talking about kidney, heart, and liver. For reference, I'd like to say that it's a life-saving technology. Ethically, one may have a different attitude to this. There are different contradictions from different confessions, religious confessions, but post-mortem donors we can use their organs post-mortemly, and it should be completely confirmed. This year, we have the record, more than 160 transplantations that were performed. Quite significant funds have been allocated. As to heart and liver, but as to kidney transplantation is cheaper comparing to the annual hemodialysis of a patient. Completing my presentation, I'd like to say, and it was mentioned yesterday by our vice government, Ergashev, it's our strategic. It's our strategy. It's a digitalization of our medical care service. I'd like to mention this portal of the health of Saint Petersburg residents. We do everything from the distance, everything in digitalization. You can see that many residents, they make use of this system. The President of the Russian Federation required to create the single medical service of Russia, and we will be part of this. Now, we have been discussed this issue, what kind of platforms to use. We have different, more than 20 informational systems. They are not completely integrated, but you can understand it's a huge area. And if everything is integrated, the information will be delivered immediately by one request. I'd like by this slide to show that our city is beautiful. You can't but fall in love with this city. Many years ago, I came to this city. I fell in love. It's the love of my life. I wish everybody good health and to make use of the opportunities that are in hand, to be enchanted by the beauty of our city and to make some prospective business contacts. I think we have everything now here. Thank you, Alexei. You have surprised us by prospects and by achievements. I'd like to remind everybody who is present here that we are carrying out the translation of our event not throughout the Russian Federation, but to abroad as well. Many people will hear you, will see you. We have a great number of people who are connected. It's very impressive, and I even forgotten that I moderate this section now. I'd like to point out that one of the flagship of medical tourism is scientific and research medical centers, the center named by academician Fedorov. It's a microsurgery of eye. Today we have got Sue Marina here, the deputy of the head of the director of the director of information and clinical work, Marina. Good afternoon, dear colleagues. First of all, in the beginning of my presentation, I'd like to express gratitude to the organizers of the conference for the opportunity to present the work of our organization that during 35 years have worked in our beautiful city. I'd like to present this information in the year of 96th anniversary of Stanislav Nikolaevich Fedorov. Without him, microsurgery of the eye would not have been possible. We'd like to commemorate academician Fedorov, and we would like to present all our achievements and our prospects. As to the medical tourism, why are we being chosen? Because we have a beautiful team of experts of different sectors. We can make a right diagnosis in very difficult clinical cases. We can solve surgical problems in any clinical situations. Ophthalmic surgery is being performed of different complexity at the world level. As to the skills of our experts and equipment, we use breakthrough technologies of diagnostic and treatment of their diseases of the eye, and our experts, they are experts in the ophthalmology, not only in our country, but throughout the world. As I've already said, we use the innovative equipment of the last generation. And of course, we are trying to ensure individual approach to each and every patient. Statistics of our medical activity in brief: from the beginning of Saint Petersburg subsidiary, we have treated 800,000 patients. Out of them, 17,000 foreign patients from 112 countries, 2,600 and 5,000 patients from 84 regions of the Russian Federation. And now we are here in our city in Saint Petersburg, where we have our goals to improve the vision of our residents. In our city, we have treated 512,000 patients from the opening up of our clinic. Tourism may be considered not as international tourism. We think that a very important goal is the development of the domestic tourism. We are the National Scientific and Research Center in ophthalmology. We are aimed at the surgery of very difficult situations that ophthalmologists may see. That can't be handled in the regions of the Russian Federation. In Saint Petersburg, we have a very mighty ophthalmological school that we can see in our medical establishments, but patients who live outside of Saint Petersburg, they can't be given this medical care, and we open up our doors for them every year. We are trying to increase the number of patients who live outside of the region number 78. And our government, the Ministry of the Healthcare, required to give the care to people who live outside of St. Petersburg boundaries. From the beginning of the establishment of our center, we have been doing international tourism. You may know that Svetoslav Nikolaevich has had the project with providing medical care on board the ship that cruising throughout the world in Arabian countries. And we do international tourism in our medical establishment. Our advantages that we can offer to foreign citizens is the high standards of medical care, the single monetary policy. We don't have the difference in price among the residents of the citizens of the Russian Federation and for foreign citizens as well. We have the professionals who of very high qualification with a very high level of equipment. It's very important to ensure a high level of services. We can support patients who are treated in our clinic 24/7 days a week. Very important point is safety and security. We ensure medical care in ambulatories. A patient may not be in-house patient, but maybe in-hospital patient, but maybe out-hospital patient as well, if a clinical situation allows. If a patient is in-hospital patient, you can see on the slides, we have a very comfortable apartments, rooms. Patients may come with an interpreter, with their relatives, and can be accommodated in very convenient rooms of our center. We ensure 3 times food intake. We have Wi-Fi in our hospital to ensure communication with the relatives while living in our hospital. Since 2019, we have been doing a huge work as to the management of quality. Many who is present here know this notion. It's not an easy work to do. It's very important managerial work that allows to realize very important projects. The projects of electronic system of the feedback with the patient. We shall know what patients think about us, how to improve, what are the ways of improvement. We need the sincere information about different phases of medical care. We have to find the problems, identify the problems, and to improve our quality. Very important points. It's mentoring, training of the personnel. We use the international system TWI. We optimize all the processes based on the digitalization. It's our goal. We improve the quality, the culture, the safety of medical care provisions. We developed the Calgary, Cambridge model while doing our relations with the patients, internal, internal audits of the quality. Everything is aimed at our mission. Our mission is the improvement of quality of the patients, of life, ensuring qualitative, safe, high technological ophthalmological care of the world level that will be available to everybody. Ophthalmology care is aimed at the social principles. It should meet the expectations of our patients according to their individual needs. On the slide, you can see the priority areas of our work. I'd like to point out the most important ones that are very important for medical tourism, both domestic and international tourism. In our clinic, we have the tissue bank. It's about cornea transplantation. In the past, to do cornea transplantation while received their tissues from the morgue for several hours, we had to do different tests to ensure the surgical team for this treatment. But imagine a patient, for example, from a different city, from a remote city, from a remote country. Now the problem is solved. We conserve with the certain media these tissues for 5-7 days. We carry out all the necessary tests before conserving. We can, as elective operation, to call for the patient, and in 1-2 days transplantation is done. It's a very important point. We can see huge advantages of this tissue bank. Ophthalmo-oncology and oculoplastics. We see a quite great number of ophthalmo-oncological diseases. Oncological diseases of the eye is the prerogative of ophthalmologists. We treat these patients sometimes in multidisciplinary team. We have oncologists in our clinic, the doctorate holder. We perform all the necessary operations that have been developed in oncological brachytherapy, photodynamic therapy. We performed reconstructive operations so that a patient may not only preserve the vision, but in case of oncological disease, for example, of eyelids, we can perform reconstructive operations to ensure the cosmetics. Refraction surgery. Young patients, they are interested in this surgery. It's not funded by the federal money. It's a kind of cosmetic surgery. We use lenticular surgery here. We have innovative technologies that are performed only in our hospital. Here you can see all the transplantation of the fragments of the retina. and pigment epithelium to cover the high regma of the retina that can't be blocked by the conventional operations. For example, in this very large macular defect, can't be treated by conventional means. It's a kind of a patch that is used in the macular region. The second clinical example, when, for example, it's age-related macular degeneration that led to the formation of the scar. And in the past, we could do nothing. But now, in our clinic, we do the work of transplantation of the pigment epithelium from the peripheral part of the retina in the macular region. It's done. It's not cadaverous transplantation. It's transplantation from autologous transplantation. Now we received positive results when we do this transplantation of the pigment epithelium from the peripheral part of the retina into the macular area to treat the age-related macular degeneration. Patients, they become more independent after this operation. In the clinic, for many years, we have introduced, so to say, remote or consulting, patients-doctor consultation. Before hospitalization, we can solve different issues, and we can invite patients, only those patients to whom we can help, so that to save patients money, to save patients time, to be more efficient in this respect. We work with the agencies of medical tourism. These agents, they should have the legal representation in the Russian Federation. They can receive 10% of all the paid services of the patient as a kind of a revenue after the completion of the treatment of the patient. You can see the email address. If anybody is interested, please use this email address and we will be in contact. If it's necessary, we can make an agreement. One more area of our work is educational tourism. We have a very brilliant sector of the science and education. We carried out different cycles, phacoemulsification of the cataract, ophthalmo-oncology, laser intraocular methods of the treatment of the eyes, vitreoretinal surgery, the current technology of diagnostic and treatment of the inflammatory vascular degeneration and tumorous diseases of the eye. 1,000 educators and doctors, they went through our cycles. Very important area of our work. It's a simulation training center that is called Wet Lab. More than 20 years in our clinic, we provide this service on the platform of Wet Lab. We use the up-to-date equipment. Very experienced ophthalmosurgeons, they give the classes. It's very important that our trainees, they can ask our ophthalmosurgeons. In Wet Lab, we have this simulator on the left slide. It imitates everything that a doctor can see during the operation. It's a unique technology. The 130 million of value of this equipment. It's a price for this equipment. Different levels of education we can ensure from 0 up to advanced level. We can improve, we can ensure refresher training of our doctors and can provide training for any specialists. Working with international tourism, we've had very important contacts with the company Aries from Cavatier. Unfortunately, now we are a bit we are in less intensive cooperation with this firm due to the international situation, but we are waiting for the teams from different countries to come. These teams, they come here with an interpreter. To the team of the patients who came to our clinic for treatment, that they also were given opportunity to go sightseeing and improve the quality of their life. Thank you for your attention. I hope for new contacts with those colleagues who are present here and with the colleagues who are online now. We hope that we will be very useful to you in our work.
Thank you very much, Marina. Great many thanks for your talk. And now I would like to pass my gratitude to our chief physician, Ernest. And I suppose that he will come back from his business trip. And also I would like to thank you for promoting medical tourism in such an active manner. I know that you also have accommodation facilities which are affiliated to your medical setting, which is indeed very convenient. So coming over to your setting is very convenient for medical tourists. And also I would like to mention that yesterday we had a hub on medical tourism. That was the first event of this kind, which we tested and piloted, and we initiated, it was initiated by Vladimir Cherdashov, the president of the Association of Medical Tourism Agencies. And also yesterday, there was a talk by an ophthalmologist, chief physician and head of the ophthalmology department from your setting. There were 9 doctors all in all invited. That was a very good vibe of the event with great comments. We camcoded it, and I hope that this video will be provided to all of you very soon. Also from Pokrovskaya Hospital, we had a cardiologist, and we had interesting discussion with great deal of work. And everybody who was present at that discussion mentioned that our doctors, the doctors in St. Petersburg, can be proud of. And the principles and the philosophy that they carry to the world is utterly important. It's great. And I would like to thank and express my deepest gratitude to all the doctors of St. Petersburg. Now I would like to pass on to 2 doctors from the Pokrovskaya setting, City Hospital, with a presentation devoted to the impressive cases in their everyday routine with medical tourists. I would like to pass the microphone to Nikolai Kuzmin, and also I would like to invite Yuri Grebtsov here, and I would like to pass the microphone to you. You're welcome. Good afternoon, good morning. I'm an X-ray surgeon and radio surgeon, and I represent here Pokrovskaya Hospital. The Pokrovskaya Hospital is a multidisciplinary setting working on several directions. This is cardiology, general surgery, thoracic surgery, and some other directions. We provide service also to patients with COVID-19. And this experience indeed is important. It's quite unique for us because we never stopped for We never stopped for COVID-19. We continued our service for emergency surgeries, and planned surgery cases also were not postponed greatly. So that's unique experience. Nonetheless, in a year after COVID-19, we continue developing, and we have already provided service to a great number of patients, including patients from abroad. From 35 countries, there are patients who come over to our hospital. We have the following directions, which are most popular with medical tourism. These are cardiological checkups and endocrinology, and also mesh transplants in the ventral hernia correction. Also, the advantages of our hospital, which facilitate medical tourism, are agreements with the transportation companies, which facilitate logistics from the railway station to hospital or airport to station. Quite convenient stay inside the hospital with good patient rooms for one patient, and also we have great number of facilities and amenities inside the hospital. I'm a radiosurgeon, and this is a section of cardiosurgery, the so-called MIS, when we have interventions via the brink in the incision, in the small incision in the skin, and it facilitates rehabilitation. We have short bed days. It doesn't require any anesthesia, and that actually means that it is mini-invasive surgery. And first and foremost, these are patients with acute coronary syndrome, as well as these are emergency patients, like this patient from Central Asia. You can see here 3 sections of compressed arteries, coronary arteries, and you can see the view before and after the mesh carcase implant. You can see that the infarction has been, or pre-infarction situation has been corrected successfully. If it is a successful surgery, we can discharge the patient the next day. If it is something more complicated, then several hospital days will be planned. Routine work is absolutely mandatory. This is a patient of 54 years of age. It is beneficial for the patient. It reduces the lethal outcome risk. And definitely, our glory is, of course, something more complicated. This is a 54-year-old patient, as I've already told you. He lives in Vietnam, and for half a year, the activity was restricted. The daughters, that was the problem with his daughter. She decided that in Vietnam she couldn't be helped, and she came over to our hospital. She had pain, and there was chronic congestion of the left coronary artery of the main stem, and we made MIS via PRINC. We placed 3 stents. And the patient came back to her routine, daily routine. She is going to come back to her daughter. Nothing restricts her movement, no shortness of breath. She can climb up the stairs and go shopping. Now, this is atherosclerosis that can impact not only the heart, but also the vessels of the neck. You can see the narrowing of the carotid arteries, which can result in the infarction of the brain, which is known as stroke. You can see the plaques that get into the brain, and the patient results in disability without losing the function of walking and speaking. So surgery is quite possible here, such as stenting of the carotid artery, as this one that we performed for a patient from Tajikistan. This is another example of internal tourism. Patient came over from the Leningrad district. You can see here a long years of smoking, atherosclerosis, a history of atherosclerosis. There was femoral shunting was done, or GABG was done. The necrosis in the foot happened later on because of the congestion of the arteries. You can see necrosis of 4.5 digits here. almost 5 digits were involved. The surgeons in the local clinic in Tajikistan, in the local clinic in the Leningrad district, refused the patient. They didn't have the necessary expertise, and he was referred to us. We did a small amputation of part of the foot. Actually, the patient has appropriate quality of life because he needs support. He is a driver. And so he came back to work, to his routine before this catastrophic event. The next pathology that we deal with is aortal aneurysm. And you can see here that there is a dilatation of an aorta, which can be accompanied or result in a rupture. And this is lethal because it results in internal hemorrhage. We can do it correct it via MIS, via femoral arteries with a stent graft implanted, and thus the risk of rupture is dealt away with. Unfortunately, the aneurysms can be advanced, and if this is the case, then the aneurysm will involve also the arteries which nourish the abdominal aorta, and also it can go into the thoracic cavity, then it is thoraco-abdominal aorta. This is a grave situation for the radiosurgery all over the world. Previously, we did it by means of open surgery with anesthesia, and there is a huge cut from the thoracic wall going down to the groins. And actually, the patient had the total prosthesis, actually replacement of the whole of the aorta. And unfortunately, even in the planned surgery, there was the post-operative mortality accounts for 50–60%. There is a new prosthesis that was devised for this particular type of aneurysm to do it off pump. And subsequently, the organs of the abdomen, the abdominal organs, they continue getting the blood flow. They do not suffer. Unfortunately, it's quite difficult to do. So we modified this branch stent graft, which first of all brings down the cost of this procedure. And if you use the original prosthesis, that would be approximately 3 million, and we have 1.8. This gives benefit for the patients who are planned patients and also who are paid for by the state insurance. This is one of the cases. The patient has come over with a thoraco-abdominal aorta. The surgery, open surgery, is something that he refused to do. So we decided to do this modified branch prosthesis. You can see here this isolated aneurysm that we corrected. This is the CT angiogram. Rehabilitation accounted for approximately 10 days, which actually for such pathology is very short. In conclusion of my part of talk, I would like to speak about the new opportunities that we devised. You can see that our department is active in searching for new approaches and new technology in the area of arthrosis. So these are patients after trauma or injury. They are refused because they have comorbidities or advanced stage patients or underfunding in certain regions. These patients can get MIS treatment in our clinic, 2 bed days. This is embolization. That means congesting the pathologically inflamed arteries in the area of the knee, which reduces the pain syndrome and brings the patient to the normal quality of life. Now I would like to pass the microphone to Igor Gribtsov, who is the PhD in medicine, and he's a colleague of mine. So, dear participants of the forum, I would like to share with you within several minutes the opportunities of our clinic to treat patients who need surgery. So we have 3 representatives of 3 medical schools in the country. This is Northwest Medical University, Pediatric University, and also State Saint Petersburg Medical University. We have 2 doctors of medical sciences, 2 associate professors, and also 1 doctor of high qualification category. So we also have joint or adjacent medical specialists such as endocrinologists, anesthesiologists. We have also multimodal anesthesia opportunities, full spectrum. We also have 4 departments of 4 ICUs, 2 for cardiology patients, infarction, and also a department for arrhythmia patients, also neurological ICU and surgical ICU for patients after surgeries. So we also have equipment of top class, top-notch equipment, which alongside with our great experience makes treatment of our patients highly efficient and very contemporary and fast. I would like to speak about several cases in the treatment of patients in our hospital. So this is Bale stone disease. You can see a bit of gallstone. You can see here patients with such disease can be provided laparoscopic and endoscopic types of treatment. If this is not advanced stage, then the patient stays with that only for 1 day for the surgery, and he will be discharged the next day. If this is the patient with some sort of complicated disease, then depending on whether he has gastroenterologist or cardiologist, maybe some other tests and additional examinations, checkups, he stays for several more days. We also have advancements in terms of the hernia correction surgery. In our hospital, we perform surgeries with the application of state-of-the-art methods, which are new even to other countries of the world. This is MILE-S and TAP and TAP. So this means that these are surgical applications and mesh implants. For example, this is the umbilical hernia. Also, it's just 1 day in hospital. There are 3 incisions only in the abdominal area around the umbilical area. It's TAP, IPOM, and IPOM plus. These are the types of surgeries that we perform. And also in more complicated cases, I mean, advanced stage patients, for example, and even geriatric patients with a number of comorbidities. You can see a patient of 90 years of age. You can see that he has bilateral relapsing hernias. We also needed abdominoplasty in this case. But we discharged the patient at day 3. We have happy family around him, which is absolutely great. And also, we have huge cohort of patients with umbilical hernias and diastasis of the postpartum diastasis, for example. This is not only functional impairment, but aesthetical view also suffers. So within 1 day, we can correct diastasis, and we can also get rid of the hernia by means of traditional methods and also by means of radiosurgical means. We have good functional outcome and good aesthetical outcome. So we have good functional and aesthetical surgery. And in our hospital, we also have complicated group of patients, and we provide treatment to them. These are complicated patients with giant post-operative ventral hernias with virtually absent anterior abdominal wall. This is expert level. This is functional and reconstructive surgery, because actually we create anterior abdominal wall and we enforce it with a mesh implant. This is one of the cases, several days in our hospital, and after that we actually saved the life because the hernia was life-threatening already. And after the hernia correction, the patient came back to a completely normal function. Another young patient that we can speak about. Again, the patient received treatment in one of the hospitals. They saved life of the patient, but they formed, unfortunately, it resulted in the formation of giant hernia, post-operative hernia, we created a radial carcase with a mesh implant along the anterior wall, and now the patient does sport and goes back to work. Lateral or side hernias, again, the patient was operated on the kidney because of the oncological pathology. And now you can see after they dealt away with the tumor, they resulted in post-operative hernia, and we corrected it. Now this, we also deal with patients with severe obesity, morbid obesity. You can see this is a patient from Kazakhstan, and that was a hernia and huge fat flap. And you can see that we removed it. We improve and we professionally develop every year. We make talks at different conferences, and we also do a lot of research and science in our hospital, because there are 3 universities of the city that we provide our patients base for. Professors, associate professors come to us to teach students. So I hope that the information that I provided you with will be useful. I invite you to enjoy the city, the beautiful autumn, golden autumn of St. Petersburg, and please remember that good health is your freedom. Thank you very much, Nikolai Valerievich, for bogging us down in a positive sense in the routine of your settings. I do understand that it's quite an important work that you do, and definitely it's something that requires a great deal of effort. Not very long ago, we had an event when the Agency of Medical Tourism from a foreign country, from CIS state, brought us to different clinics, and we also couldn't but visit the big federal setting of oncology named after Petrov. We have a presenter here, Anna Malkova, who is the head of the information department, as well as telemedicine department. It's information telemedicine. You are welcome. Could you say a couple of words about your setting? Yes, Svetlana, can I have the clicker to flick the slides? Good afternoon, dear colleagues. Thank you very much for inviting me here. Indeed, that's a very important session. And indeed, the Fedorov Center is the pioneer in this area, and definitely everything that Marina Vasilyeva mentioned was once already organized by this person. These were steamboats, and me, myself, in a childhood, I was hospitalized in Cheboksary in such setting in the head office. Then it was quite long ago. It was quite difficult to travel there, but even then I was very much impressed. Although I was just 11 years of age, I was impressed that I was examined within 1 day. There was a patient's room for 1 person. Partly it was fee paying. It was not free of charge fully, but nonetheless it was really very impressive. My parents chose that setting, named after Fedorov then, because that was the best in the world in terms of treating the disease of the eyes. And I suppose we should take them as a good example of successful medical service, successful medical setting, and we should definitely take into account how well everything is developed there, and how they invite people from all over the country, and not only from our country. I would like to speak about my setting, named after Petrov. We are going to have a centenary anniversary very soon. It was founded in 100 years ago, but the premises that we are functioning in at the moment were constructed in 1960s in Pisochny, which is in the vicinity of the city. Beautiful views and very good fresh air, and you can walk along the Bay of Finland and also get some rehabilitation after you get quite difficult treatment for oncological disorders. Starting from 2070, we started national medical centers. We are not an exception here. Many of federal centers were renamed like this. We deal with comprehensive diagnostics of cancers, starting from surgery, then radiotherapy and pharmacotreatment, systemic chemotherapy. We do all of it. And at the moment, we are going to, we are looking forward to the new building, which is being constructed at the moment, and we hope that we will have bigger territory, greater number of beds and patients' rooms, because at the moment, we enjoy our premises, but it was constructed quite long ago. We have good patients' rooms, but still we have rooms for 4 patients. For tourists, of course, it is not suitable. We also deal with bone marrow transplantation. We have molecular genetic testing. We have reference center on radio diagnostics. We have distance services for patients which are ever developed, and we also use ID and identification for Russian patients, and also private personal accounts for the foreign patients. So you can see that we have over 1,600 employees, 350 doctors, 60 doctors of medical sciences, 134 PhDs in medicine. We have 5 correspondent members of Russian Academy of Sciences, 30 professors, 4 honorary scientists of Russian Federation, and we have great number of patients. 30% are of endoscopic patients actually come from Saint Petersburg, but most of them come from different other cities of Russia. We have a number of different other settings that provide similar service in like Pokrovskaya Hospital that talked about their patients. We had a sarcoma patients who got treatment from with Petka sarcoma, and in Pokrovskaya Hospital they provided a very complicated surgery, and they talked actually to him, and he later on rendered his experience to us. That's a multimodal approach. That's exactly how it was happening. Now we invite patients from 83 cities of Russian Federation. Our Ministry of Health set a goal for us that we need to treat a certain number of patients who come from abroad, and so within 2 years and 8 months, when it comes to the fee-paying medical services, 138 million came to our budget from foreign patients, and almost 31 million, that means these are money that come from insurance companies, Russian insurance companies, but the insurances were bought, recruited by the foreign citizens. Professor Levchenko deals with the isolated perfusion of the distant metastasis of the lung cancer, and also remote metastasis where there is metastasizing of the main tumor, of the primary tumor. He does it both in children and adults, and we provide this manipulation for all patients. It's an open surgery and manually. Evgeny, for several hours, removes these smaller metastases. If they are approximately 80 in bilateral, it's a bilateral process, then it's within 1 surgery. If it is more than 80, then we can have 2-tier surgery.
What else is important? We have received the reward. Evgeny received the reward. These patients, they're still alive. They have been living for a long time. We cooperate as in pediatrics, so with the center named after Rogacheva in Moscow. They treat the main disease, sarcoma, and then they refer patients for chemo transfusion of the lungs. We perform bronchoplastic operations. Evgeny performed 400 bronchoplastic operations. It's a minimal invasive operation with a small incision. Evgeny put together bronchi, removed the tumor, preserving the plasticity of the lungs. Patients, they are discharged very quickly in good conditions, and they can do physical work and physical loads. Oncomamology is operation-free treatment of the mama, of the breast. The breast is preserved because the tumor is aspirated through the small incision. We perform prophylactic mastectomy to women with the hereditary cancer of the breasts, and Angelina Jolie is an example of such kind of women. She went through prophylactic mastectomy. She had ovary removed, and we could do the similar, can do the similar operations for domestic patients and for foreign patients. We can do oncomamology operations. Here you can see the patient, active patients, female patients. It's the patients from her own archive. On the slide, you can see patient before the operation and after the operation. You can see that the implant was put into under the skin. She had the total mastectomy performed, and she is very satisfied. Very good aesthetic result. It's an oncological disease. Radiotherapy. All the radiosurgical stereotaxic radiation we use, high dose brachytherapy. We do planning on the up-to-date equipment. Today, we are going to install the linear accelerator, and we can treat more patients. Patients are suffering from metastasis in the brain, pulmonary oncology, the exposure, radiation exposure of the bed of the tumor in case of prostate cancer, breast cancer. Also, we work with 3D printing implants, restoring bone defects. The first implant was implanted in 2015. Now we performed more than 60 implants with individual 3D printing and the prosthesis. Patients they're then rehabilitated. We support these patients for a long time. Patients can take care of themselves. We prevent disability of these patients. Before we started to use this individual prosthesis, these operations, they used to be very debilitating, and patients became invalids. We use transplantation of the bone marrow. It was already shown how the transplantation looked like of the donor organs. Now we are talking about transplantation of the bone marrow. It may be from the donors and autologists. In 2016, in 2022, we performed 113 transplantations and 28 transplantations for children. We treat both domestic and foreign residents. These patients, they are placed in separate wards. Patients, pediatric patients, they live with parents. Any kind of leukosis we can treat quite successfully. Operations on the CO2 laser, early cancers of the larynx, of the tonsils. These operations are very traumatic. Patients don't like these operations to be performed. They are very resistant to treatment. When the larynx is removed and a patient cannot speak in the future, it's very traumatized operations. Now we have the month that is called Rose October. We raise awareness about the breast cancer. We raise awareness about this disease among women and among men. We encourage patients to go for medical checks. As to ENT organs, we do carry out awareness at the special days in September. This year, all the state-run medical establishments participated in this program. We conducted a great number of medical checks. We participated in these programs, and especially smokers, they are to be exposed to early medical checks of these diseases. If any early symptoms arise, patients are encouraged to go to doctors earlier. There are maybe when you brush the teeth, you can see early symptoms, some white spores on the gums, on the tongue, and it's easier to treat comparing to advanced stages of this cancer of third or fourth degree. And when patients are at these late stages, they are afraid to go to doctors. A patient becomes fearful, but we encourage patients to go to doctors for organ preservation operations, for later plastic operations, for the qualitative, high-quality treatment with aesthetic results. In 2021, we opened up 2 departments, one angiographic department and neurosurgery department. We perform angiographic operations under general anesthesia. It's very important for us to diagnose metastasis at the early stage. If metastasis of small size, we can perform a minimally invasive operation in the liver or embolization of metastasis. We had Da Vinci robotic equipment. We have been working on this equipment since 2022. We perform urological and abdominal surgical operations. Molecular genetic testing is NGS testing that allows to assess and calculate mutational load to identify the most important tumor-associated mutations. We perform the test for 179 of the most important tumor-associated genes. It's performed according to the indications identified by geneticist, by the doctor. If there is some predisposition for oncology diseases, these tests can be done after consultation. According to these tests, patients may be given immunotherapy. systemic chemotherapy. We may decide what kind of therapy to perform according to genetic testing. The full exome DNA analysis, the NSG panel for deep diagnosis of the tumors, target sequencing of the DNA, target sequencing of driving mutation and translocations of the tumors of the lungs. The head of our genetic department, Dr. Imenitov, he is known throughout the world and the laboratory of a very high standing. We have the reference center for interpreting of pathological, morphological, immunohistochemistry, molecular testing. We can receive the samples for testing to our reference center. All these samples can be sent from abroad for molecular genetic or pathological, morphological testing. On the slide, you can see the number of tests that we perform as a reference center. Only all these samples that were sent to us, we can perform all these tests covering by obligatory compulsory medical insurance. We have cell technology. We use anti-tumorous autologous dendrit cell vaccine. It can be used in different diseases, in sarcoma, melanoma, in the tumor of kidney, in the 3-negative breast cancer, glioblastoma. We use our scientific development. Contact center today works 7 days a day from 9 to 21. You can order the call back from different part of our country, from abroad. The slide shows the number of calls that are processed by our operators. 714,000 will process during 2022. The outcoming calls, by outcoming calls, we clear up the situation with the patient, the condition of the patient. We invited the patient to our center. I've already mentioned that there are improved comfort rooms. We do have these high-quality rooms or high-quality wards, but we hope for the increase in the number of high-comfort rooms when our new building that is under construction is finished. Thank you. We have the amazing person who is here in the room. It's Kashchenko Viktor. He will complete and finish our section. I'd like to read out all your accomplishments. The deputy of the general director of the Northwest Clinical Center, named after Sokolov. As to the scientific and educational work, the senior surgeon PhD holder, doctorate holder, the head of the chairs of the facultative surgery of Saint Petersburg, the laureate of Russia in the medical field, the revered doctor, the member of a surgical society named after Pirogov. And distinguished colleagues, thank you so much for the presentation, for introduction. Today, we are talking not in front of the surgeons. It's very difficult for me because my audience mostly are the surgeons, the oncological surgeons. Today, we have been talking about medical tourism. It's not very easy for me as a surgeon to talk about, to discuss this topic. The first thing I'd like to ask, and I'd like to ask the question, why are patients become interested when we offer him or her to choose the hospital, to select the clinics, to come to this or that medical establishment? What is attractive for a patient? Can you name something? The level of specialists. As a rule, yes. And a clinic. What is important for a clinic to be chosen? Not only service, first and foremost, qualification of the specialists. To initiate a feedback from the room, I have the friend Alexei Karacher. He works in the Institute of Oncology. He's a brilliant expert. He says the following, that a patient values two things. The first, to be painless and to have a very aesthetic and cosmetic suture. It's a joke. By discussing and talking about what patients notice, what patients want to think, I'd like to get back to the deep instinct. When a patient is faced with a problem on the surgical treatment, it's a very severe stress. When we think about the operation, or when we think about our relatives who are to undergo the operation under the severe stress, if we try to invite a psychologist and to dig out the roots for making this or that choice, I would like to say that the most important thing here is safety, because a person understands that he is to be in a very dangerous situation. He wants to be alive. He wants not to have complications, to have a guaranteed results of being cured. And this message is very important for me in our dialogue that is devoted to the concept of the safety surgery. And we have been developing this concept. I'd like to familiarize you with the foundation principles. I'm representing a multidisciplinary hospital, but each discipline is different. Each specialist is to realize this concept. The slide shows this multi-level concept. Without improvement of your skills and knowledge, you can't achieve the results. We have two levels. Organizational level, very important, classical management of quality, at the systemic level. In each hospital, there is a quality insurance department. In our project, our principle of quality assurance, we apply this to surgical treatment. It's not just identification of a patient, control of a patient, marking of the patient, but no one can influence the manual skills of a surgeon. It's a reverence. It's a secrecy. Can we influence this part of surgery or not? The quality insurance issues, we are not going to talk about this now. Now we will be talking about the second level surgical technique. The first and foremost, preoperative modeling. What is the modeling? We used to have two processes, diagnostic and treatment. First, we had to diagnose, to examine the patient, then hospitalize the patient and carry out and apply the treatment. Now, all these processes, they are integrated, they are intertwined, not because surgeons, they are interested in CT and vice versa, but we pull together in all our processes, not only in the time, but in the space as well. Preoperative modeling, when an individual image of a patient, you can see the anatomy of arterial and venous system, you can see the virtual glasses, the team of the surgeons, they discuss the minute things, details of the operations. And then we transfer this model in the operating theater. We operate with the augmented reality glasses, and all the individual anatomy of the patient is transformed from preoperative situation up to inter-operation setting. We can see the right side hemicolectomy. The specific feature of this operation is in the fact that each patient has individual variation of vascular anatomy. And if a surgeon made a mistake in laparoscopic treatment, it's possible to have the problem of identification. It may lead to complications. To prevent this complication, we place individual image of a patient in the operating theater. We can go further. Here we consult this image, the images outside of the patient. The idea is to put together virtual reality and real reality, to put together all these images, and augmented reality technology can help us to do this. Here it's a cystic tumor of the pancreas that changed the vascular system of the pancreas. You can see we make the individual atlas of a patient in the operating theater. I do perform this operation. I understand the specific features of the anatomy of the vessels. We use fluorescent enhancement technology. Regulations, a document that describe the stepwise processes, standardized processes in the operating theater. When we see certain risks, if it's a non-regulated process, the risk may infringe algorithm leading to complications. Undoubtedly, surgical community have the negative attitude to standardization, saying the surgery it's not. I am an artist. But if you look into the depth of the processes, any process can be standardized. Our goal is to prevent external situation influencing the results. On this slide, we can see our surgical society. You can see Alexei Karachun on the left. We meet up in the Philharmonic Society of Jazz. We listen to jazz music. You can see Mr. Vladimir Litkin and other jazz musicians. They seem to be improvising. And we ask the question, how can you play so beautiful music? They say that all the musical tunes, they are set in the notes. All the improvisation is going out on the basis of the notes. Our message is to have the notes, the basic notes for any operations, and without false attempts, without mistakes. It's a guarantee of success that a patient will come out of this process without complications. Figure skating, it's the art, but please look how Evgenia Medvedeva is decided to be a champion in the scores of her artistic skills and her technique. And we ask the question, can this be applied to surgery? Now we have the system of the quality control of safety of surgical treatment. For this, we introduced the system of checkpoints. It's a very wild match point. It's a well-known film by Woody Allen. And the ball that is suspended above the net may drop on any part of the pitch. We break the operation into different elements. Each element have its own photo fixation, standardization, and we can ensure high level of safety and reproductivity of the operation. There are laparoscopic cholecystomy. Steven Strasberg, he was a hunter. During hunting, he noted the importance of carrying out the clear instruction of shooting. He applied the similar requirements to laparoscopic cholecystomy. Now there are clear checkpoints, criteria, when the surgeon can sever the golden blood duct. It's an example of how the clear recommendation, how the clear regulations and understanding of checkpoints can ensure safety of the surgery. The next slide shows the surgery as an art. It's ICG enhancement, body art, when they are fluorescent enhanced. Navigators are used widely in our routine practice. We drive along the roads of our city, coming from and to work without navigator or with navigator, but there are car accidents or traffic jams. You may not know this, but navigator will help you. It's an additional channel that the drivers, motorists use. Now we have additional channels that we can use for safety of surgical treatment. Cholangiography, when we introduce ICG enhancement intravenous, and we can see the goal tracks. We have a certain kind of markers, not to mistake this or that anatomic body. Lymphography, angiography that allows to guarantee that anastomosis that you made will be patent and reliable. And even a drop of the contracts that can leak through the sutures, we can see that it's a mistake, and we have to correct this mistake. Now we have the domestically manufactured ICG. We have been criticized. How frequently do you have the damage of Kaledek and you need to use ICG? According to the statistics, you can see 0.1% up to. It's a very, very small number. It's a golden standard. And we say the system of the aviational safety, if the accident will happen with one aircraft, we will see 136,000 accidents per day. It's obvious that the most dangerous territory for any person is a clinic, because in clinic you run the risk of having complications, you run the risk of die, and it's higher comparing to other situations in the world, in the car accident or in the air accidents. Let's look at this operating theater. It's a very complicated operation. You see the different units, ICG, fluorescent perfusion unit, and different other units that can control safety in the operating theater. It's how the control is ensured in laparoscopic operation. Here we have pathological physiologists. They can decipher, that can interpret at which point to stop, whether or not this anastomosis will be safe, or you have to ensure better safety on this anastomosis according to the interpretation done by pathological physiologists. We have the chambers, ICG chambers, that can give us information not qualitatively but quantitatively. You can see our operation that we perform in colorectal cancer.
We have already prepared the bowl, and before that we infuse ICG. And on the left you see a beautiful picture when we can say that the perfusion is good enough, but that's your subjective opinion. But here on the right you can see a graph that mathematically calculates all the numbers and gives you confidence that this anastomosis will be patent. So this is Biomedical Optics Express publication that also proves that actually anastomosis in figures and this confidence is a key to success. Thus, dear colleagues, I would like to move on and make conclusions that the development of post-operative complications actually ruins the achievements of the state-of-the-art technology. You can do robotic surgery, but there is a failure of anastomosis and the sepsis, and the patient dies because of septic complications. This actually ruins all your efforts in terms of technology and using techniques. So complications actually ruins all the financial benefits of your hospital. And also safety is the key factor to the life of our patient, because if we determine, if we prioritize and find the cornerstones, then safety will be definitely the cornerstone to look at. Thank you very much for listening to me. Thank you very much, Viktor Anatolievich, for such deep and very detailed presentation. So I suppose that today we're very grateful to each and every of the speakers, because you managed to demonstrate indeed the achievements of medicine. You also can see the prospects for the future. I would like to thank Yulia Alexandrovna, who started by determining the growth areas. I would like to thank everyone. I'm closing the session, and in an hour we're waiting for the second session. We're waiting
Can everyone hear me? Colleagues, good afternoon. First of all, I would like to thank you for finding some free time to attend this event. Thank you very much to you. Here with us, our colleagues who came here despite their packed timetable so as to discuss the potential of further collaboration on medical tourism. And I would like to introduce to you our colleagues. Raisa Nurjaobayeva, President of the Association of Medical Tourism of Kazakhstan, is with us. Also with us is Nasiba Uzakova, CEO of Nasiba Tour Company. Muhammad Alim Tursunbayev, Vice President of the Medical Tourism Association of Kyrgyzstan, co-founder and deputy chairman of the Association of Private Clinics and Medical Institutions of Kyrgyzstan. Also with us is Emil Hasanov, Vice President of the Medical and Thermal Tourism Support Association of Azerbaijan. And if you allow me, I would like to say that one of the speakers has a birthday, and regardless of that, this person came to us. Thank you very much to you, Emil. Congratulations and all the best to you. Also with us is our colleague from China, Wang Xiakun. She represents Chinese Traditional Chiropractic Medical Center and Chentai Cancer Center in Anshan. And Solesh Kalenova, Doctor of Economics, corresponding member of the National Academy of Sciences of Kazakhstan, honorary member of the Global Association of Medical Tourism, Kazakhstan. I would also like to say that one of the experts will be speaking online. This will be a speaker from India. He will speak in English, and that is why I advise you to take all the necessary simultaneous interpreting equipment that you may find at the entrance to this hall. I would like to declare this session open and give the floor to our first speaker, Raisa Nurjaobayeva. You are given the floor. The floor is yours. You're welcome. You can sit or stand up if you want. It's up to you. Dear friends, dear colleagues, and participants of this forum, let me welcome you all here in Saint Petersburg. And we could see the beauty of its colors, autumn colors. I think this is one of the most beautiful cities in Russia, and actually gloomy weather really matches it. And St. Petersburg is charming, and it's this gloomy weather. My speech is going to zoom in on medical tourism and its new forms of integration. I think that Russia and Kazakhstan have been long tied by relations in different domains and different areas, and tourism is not an exception. Today, medical tourism is becoming a vital form of tourism that brings together different regions and countries in their interactions in different domains of life. This helps us bring medicine to a brand new level. The future of medical tourism, what can we say about it? As we know, CIS countries are bound by common history and common traditions and mentality, not only by territorial proximity, but also by lack of linguistic barrier. All CIS countries are home to people who can speak Russian perfectly well, and our mentality, history, and traditions all bring us close to each other. Our territorial proximity to each other is another factor. The training of our medical staff. Our countries have always been connected by integration, and I've run through some traditional aspects, basic aspects related to this topic. Sorry for this technical inconvenience. I can see that you're struggling because you find it hard to see the screen. Can you please tell us how long you have been working with Russia in this domain, in medical tourism? We have always worked and we will keep working with Russia in this field. I know it for sure that I know this from my friends and acquaintances that people came to St. Petersburg and to Moscow to get treatment and actually had quite considerable progress. And which areas are most demanded among patients from Kazakhstan? Which ones are most inviting? As far as St. Petersburg is concerned, fertility tourism is well advanced. And we can see that some results have been achieved and children were born, and cardio surgery is also very prevalent, stenting and other technologies. Many tourists come for transplantation purposes. Also, dentistry is one of the most widespread areas. As for orthopedics, yes, it is quite relevant too. Actually, resort-based treatment is very common, and I would like to give the floor to our colleague from Uzbekistan.
And of course, I can let you take my place. Thank you very much. First of all, I would like to thank you for the invitation to be here today. Great thanks to the organizers for the excellent organization of the event. It's not my first time in St. Petersburg, and I love this city. I usually come here in summer, and now I experience freezing cold, but it doesn't change anything. The people are wonderful. Thank you very much. I would like to tell you a couple of words about my company. I'm from Uzbekistan, which is very warm, very beautiful, from the city of Tashkent. My name is Nasiba, and I'm the general director of Nasiba Tour Company. We are working with tourism and house tourism included. We have been operating for more than 10 years in the market, and we've accumulated a big part of experience here. Our messages are highly qualified and work in different directions of tourism. Health and wellness tourism is a very popular area, attracting inhabitants of Uzbekistan. Like, for example, detox tours, which we offer, rehabilitation tours. We are sending tourists to for holiday travels, but we also combine these trips with some health procedures if they like. What should be mentioned in particular? Why is it convenient for us to work with Russia? We have direct flights. It's very that helps us to give a variety of services to our tourists. As for today, our tourists also appreciate going to the Czech Republic, Georgia, for example, Batumi, Azerbaijan, Naftalan, India, with different retreats and Ayurveda tours. What are the pros of the Russian market? We don't have any language problems. We enjoy proximity of cultures and mentality. We also have direct flights to the biggest cities of Russia. So that's why Uzbek tourists appreciate going to Russia. The most popular direction is, of course, mineral water resorts and the resort cities of Krasnodar region. Thanks to the variety of medical services, these directions can be offered to tourists along with different wellness and healthcare services. And we can also offer different packages depending on the financial and income status of our tourism. And we actually observe rising demands of all possible financial segments of the tourism. In Uzbekistan, the following treatments are most popular. These are the pulmonary diseases, and in Russia we can send people for treatment of pulmonary diseases, respiratory infections, and all other diseases. There are different procedures, for example, mud treatment. Our tourists also come here to rehabilitate after cardiovascular surgeries. Russia offers Russian health and rehabilitation centers offer a variety of services for rehabilitation after cardiovascular surgeries. Besides, hypertension is treated here very effectively. The treatment includes cardiological procedures, physiotherapy, massage, and other procedures. Our tourists also appreciate coming here to treat their muscular skeletal system. They also come to treat their back pains, spinal cord, and so on. The procedures include massage, spas, and all other methods. And our tourists are really happy when they come here to Russia. Russia also offers services for treatment of psychological and psychiatrical diseases, neuroses, depressions, stress disorders, and other nervous and psychiatric disorders. Here, our tourists can get psychiatric treatment, therapy, in all possible treatment methods. Uzbekistan has a number of health centers which are especially popular among our citizens. They are all located in Saint Petersburg. So these are the health centers we're cooperating with. Our tourists are always happy with the treatment. Moreover, our cooperation will continue. And I would like to mention a couple of words about our health centers, if you don't object. The growing inbound tourist flow is something that we also observe. In last year, there was a treaty or action plan signed between the governments of the Russian Federation and Uzbekistan to stimulate tourist flow between the countries. And the number of tourists coming to Uzbekistan from Russia showed 6.6-fold increase. And if you compare it with the figures before the pandemic, we can even see a bigger increase. I would like to add the reason why Uzbekistan is an attractive country for tourists from Russia. Pricing policy, first of all, no language barrier, similar mentality. Apart from the treatment, the tourist can also enjoy Uzbekistan, its history, Samarkand, Bukhara, and other cities and regions. Thank you very much for your attention. I would like to add that our relation will strengthen Uzbekistan and Russia from both ways. Thank you very much.
Thank you very much for your presentation. Thank you so much. Now I would like to give the floor to our colleague from Kyrgyzstan, Vice President of the Medical Tourism Association, Muhammad Alim Tursunbayev. The floor is yours. Hello, dear friends. Above all, I would like to thank the organizers for this important event and welcome all here in St. Petersburg, this wonderful city. This is where I served 35 years ago in the ranks of the Soviet Army, and I have visited all the landmark sites and museums, and I keep dreaming about this magnificent city, so I grasped this opportunity to come here. So what do we do? What does our Association of Medical Tourism in Kyrgyzstan do? Who are we as the association? We are a non-profit organization targeted at implementing and promoting medical tourism in our republic, as well as on promoting and strengthening, boosting the image of Kyrgyzstan's medicine on the global arena. So we were established in 2017. There are two proponents of this association who are most active, Aybek Alanov and I. Since 2015, we have been active as part of the Association of Private Clinics, bearing in mind that it is important to share the experience and to help patients. We thought of establishing this association. It is part of the global healthcare travel structure institution, and if we come down to our areas of activities which may be interesting to people, here I would mention three basic areas. First one is medical tourism, which we're planning to promote. Then health resort tourism that has been there since Soviet times. We have a very important, well-known lake around which health resorts are located. I'm pretty sure that some of you may have visited it already. And thermal tourism with hot springs in our local mountains are well known too. If we speak about medical tourism, health tourism, we can say that private medicine gives an impetus to this tourism, and enables us to go beyond the national scopes and boundaries. So we started to import professionals from Saint Petersburg, from Moscow, Novosibirsk, Perm, Saratov, and other cities. These are our friends, highly skilled professionals who help our local staff to improve their expertise, enabling them to provide more high-quality services. We have a total of 32 resorts, health resorts, 55 private clinics, and our health resorts include around 4,500 beds. Here you may find a list of the most popular health resorts and private clinics as well. Kyrgyz clinic was set up together with Novosibirsk colleagues from Novosibirsk, and cardiosurgery clinic. Cardiosurgery is gaining momentum. We train our staff in Russia and sometimes in Turkey as well. So where do people from Kyrgyzstan go to for medical treatment? The first destination point is Russia, and as it was previously flagged by the other speaker, there is no linguistic problem. There is no language barrier. So I know that people who I know have all been to Russia for some medical treatment. Of course, those who are more well-off go to Germany, Israel, and Turkey. Those who have more money go to these countries. So which diseases do they usually get treated for? They first of all go there to undergo transplantation surgeries. These surgeries are done in Russia, in China, Turkey, Israel, and other countries. According to a study of an international consulting company, we can find out the core motivations that drove people from our country to other countries to get treatment. So first of all, they went there for progressive technology, for high quality and safe medical technology, and the other reason was quick access to medical services and low cost of treatment. So to put it in simple terms, people should go for safe and accessible medical treatment, along with progressive technology. As we already see, people are not so much driven by low cost. It's their health that they are interested in. What are the relations between Russia and Kyrgyzstan in this regard? Quite close, very close relations. We can mention here that we are both members of the UN, OSCE, CIS, CSTO, and so on. So more than 120 contracts, agreements, and other cooperation instruments or documents have been signed between the two countries. So Russia is a trade partner, but it turned out that there are no recent government-level documents, official documents signed at the government level between the two countries. The latest one rather, dates back to 2000s. So, in 2021, together with partners from Russia, we opened children's departments for neurology and reflexotherapy in Bishkek and Osh. And we're working on current reflexotherapy, which is a unique method, and rehabilitation of children with mental and nervous system disorders. We thought we would need more time, but actually over 2 years we have done quite a lot, and we can see tourists coming from Kazakhstan and neighboring countries like Uzbekistan and even from Turkey. So people are coming for us, taking their children for rehabilitation purposes. So what are the first steps of Kyrgyzstan and Russia in official collaboration in medical tourism? Here we may see that from the 5th to the 7th of April 2023, there was the 5th Siberian Tourist Forum, which included Siberian Health Travel Forum 2023. And regrettably, I was not part of this event, but this is the president of our organization. In the picture, you may find him wearing a hat, national hat. So there are a couple of pictures involving including showing our partners from Russia. These are pictures from Novosibirsk, from Kyrgyzstan, from Osh, and other venues. 2 years ago, Osh, which is the southern capital, opened a Russian clinic, Kyrgyz-Russian clinic that provides diagnosis and treatment of cardiovascular diseases, intervention, diagnosis, and treatment methods and surgeries for relevant patients. I think that medical tourism can also include the import of medical staff, and in this slide you may see that Mishalkin Clinic in Novosibirsk is sending their important professional, Oleg Kristyaninov and Mr. Kadir Aliyev from Perm. At least 2 times per month they come for complicated surgery and other purposes. So this is our common practice. In this slide, you may find information about Medical Tourism Alliance with our friends here, and we are working in this direction too. So what are the obstacles for medical tourism in our country? It's not a secret that the development of medical industry still leaves much to be desired. It is lagging behind the international practice and different parameters, including low quality, low level of technical equipment, low number of highly skilled staff, so poor state of facilities. These are abstracts from a thesis, from a dissertation written by one man. So what do we have to do so as to ensure sustainable growth of medical tourism? We need to first lay forth a concept for the development of medical tourism for the future period. We need to attract investment for this market, create marketing laboratories to attract clients, create a highly recognizable brand for medical services, improve the infrastructure and development of respective products, improve the quality of services and hospitality services in our medical institutions, provide personnel with an opportunity to study foreign languages and include academic plans, curricula in universities across such areas as management, marketing, business administration, and other disciplines. So, moreover, there was an open joint stock company set up with the Foundation for Support of Tourism Development in Kyrgyz Republic. It happened in 2022. It was done to support sustainable development of tourism in Kyrgyz Republic, in Kyrgyzstan. So we are going to continue work in this direction. So why are we attractive as a country? You know that we had some changes in our social and political environment, and the new government stepped in. And therefore, there are some plans concerning the development of different areas, such as hot springs, mountains, tourism in mountainous areas, and so on. These types of tourism have already been there. It's just that they need to be upscaled, brought to a new level. And medicine, health tourism can also contribute it might, so that they all work together in synergy. So no linguistic barrier, direct flights with many cities in Russia and CIS countries. A number of new airports are being opened. There is a mega project for the environmentally clean town or city of Osman, and they have already started construction works. Our president has supported this project so as to turn it into a city of future, like Qatar. And I would also like to inform you that we are hosting international conferences. For example, on the 12th of October, there will be one, and we will send out information about it, and it will be done online to continue this forum to provide a platform for substantial discussions of the ways we can collaborate in medical tourism, medicine tourism, and health tourism, so that people can tap into these opportunities. Thank you, and come to Kyrgyzstan.
Thank you very much. Thank you very much, Mohamed Amalin, for your interesting presentation, for sharing your experience of how you interact with Russia. And another great thanks to you for coming here with your traditional headgear. I would like to mention that we hosted a Russia-Africa forum, and we had a lot of delegates from Africa wearing their beautiful national dresses. And I would suggest wearing traditional dresses and headgears when coming to the forum. I think it will add color to our forum, and I think I will take a traditional women's headgear for our next session. So I will wear it, I swear. So, and now I would like to continue the topic of health tourism, and let me give the floor to Emil Gasanov, who is the Vice President of the Association of Support to Health and Thermal Tourism of Azerbaijan. We will be happy to know more about health and wellness tourism in Azerbaijan, its current status and prospects. Emil, the floor is yours. Good afternoon, ladies and gentlemen. I would like to thank the Russian friends, colleagues, partners for inviting me to be here with you. Thank you very much. Happy to see you all. Today, I would like to speak about the current status and prospects of inbound and outbound health tourism in Azerbaijan. Look, in 2016, the roadmap for development of the industry was adopted in Azerbaijan, and also a bill passed prompted quick development of health tourism, because the geography is huge. Our natural resources, the only of its kind naphtha and oil, our mineral and mud wells, Our Galalti Health Center is one of its kind. So we call one of our springs the second Karlovy Vary, and that's the health center where you can come without requiring a visa, and it's even better. And also we have salt caves helping people to treat diseases of pulmonary system, and the people who grew in the Soviet Union, they knew about these beautiful places. The younger generations didn't know as much, but we try to promote and to disseminate this information. Well, the majority of our guests are in the age group between 40 and 50 because they have heard a lot about us. So what services we provide? We provide skin diseases treatment, neurology, fertility-assisted technologies, gastrointestinal tract diseases. We have virtually everything. That's why in 2021, when the law was signed by our president, Aliyev, the development began quickly grew. And it means that the operators, the actors of tourism can build their own association, of course, in conformity with the legislation. We have our 7 golden steps, which will help the tourist sector in Azerbaijan to develop. First, to establish a foundation for support of health tourism. Second, adopting a law on incentives and subsidies, that is, reimbursing the costs. For example, companies who provide information, who share their potential, at fairs, at seminars, workshops, go abroad to promote themselves, the state will compensate between 30 and 70% of their costs for these activities. So each association can be sure that if some costs incur, they can get cashback from the state. Then, number 3, all copies of travel documents can be submitted and upon compensation. For example, well, the minimum period of treatment, let's say it's like 7 nights, 7 hotel nights. Well, why? Because you know that health tourism is more beneficial for the city, for the country. A guest coming just as a tourism, he or she usually comes for a couple of days. But if you go on a health tourism trip, you can stay for 20 days, for example, and then move from region to region. So if a guest stays for 7 nights, we don't usually call them patients. We don't call them clients. We call them guests because we all are friends. We used to be a big family in the past, so all of them are our guests. So if a person comes for 7 days, they spend about 1,000 Azerbaijan manat, which is probably $600. So annually, the country hosts more than 1 million health tourists. If the state pays for one person the sum of 70 Azerbaijani manat, it becomes a cashback. So it means that the organizations get compensated for 70 million Azerbaijani manat, which means at the same time that the country gets 1 billion Azerbaijani manat. That's why we're hurrying up with implementation of all these measures. For tourist companies bringing tourists from abroad for more than 7 and up to 14 days, The national carrier, Azerbaijan Airlines, must provide a 50% discount on flight tickets. So it means a guest will know that he or she can receive a very good discount when coming to Azerbaijan. Number 5, cancellation of 18% VAT for inbound and outbound tourism operations. There should be a differentiated taxation system implemented. Why? Because 18 VAT is to pay 18% is not good for, is not profitable for companies. 6, 5-year bank loans with 1.5% of interest. In the city of Naftalan, we have about 17 health centers, health and wellness centers, and these centers offer our guests any services they can desire. It concerns treatment and all other stuff. And the price level is really different. Each guest can receive what he or she is searching for, and the prices usually include staying in a hotel, meals, and so on. Number 7, the last one, is establishing information representative offices of Azerbaijani tourism in foreign countries. Azerbaijan is a target country for Russian, Iranian, Turkish, and Georgian tourists. In 2018, we built an international hospital Bona there. Different doctors of high category work there from different countries of Europe. And they work with oncology, cardiology. So the clinics, this hospital has it all. What else can I add? In terms of CIS countries, most of the citizens of these countries come to our Naftalan resorts. These are health and wellness centers, Galalti mineral wells, Naftsu, and other health centers in Azerbaijan. One of the favorite places for CIS tourists in Naftalan. Once again, I'm actually repeating it. Health centers of Naftalan are especially popular. So there are different packages to attract tourists for each season, for each month, for each budget. There are different offers. The guest can manage their own package. The innovation solution suggested is branding the city of Baku. And why is it important? Because the purpose is to transform it into the capital of health tourism. Why Baku? Geographical position, first and foremost, Caspian Sea, shore, sea, air, filled with minerals. And when we run similar congresses and events, we can also solve different problems. First, we can demonstrate possibilities and capabilities of our health organizations, and at the same time, we can also attract international partners and enter into different agreements. And that's what I'm saying, and I hope we're on the way to. Let's speak about outbound health tourism. Politically and economically, we have always enjoyed good cooperation with Russia. We have a joint border between Azerbaijan and the Russian Federation. Maximum 4-hour drive from Baku, and we are in Russia. And the interest of Azerbaijani tourists to Russia and St. Petersburg rises significantly. The pandemic played its role, of course, but now the interest has been gradually restoring. Anyway, with all problems, the tourist flow or the search for medical treatment from Azerbaijan to St. Petersburg saw a two-fold increase. It means people started to contact institutions in St. Petersburg for treatment or other purposes like wedding tourism, for example. And now, as it's called, like event tourism, coming to some events. As the pie chart shows, you can see areas of interest for tourists by segment. So the most tourists are interested in health and sport tourism. People are coming back, and they're interested in coming back to Russia and St. Petersburg. While unfortunately we can say that nowadays we face oncological diseases which happen in younger people. So it means that the level of oncology found in patients has become as big that we are kind of forced to send patients to other countries. Earlier, we used to send our patients to Germany and other countries, and now we send them to Russia. In St. Petersburg, in particular, we have several hospitals involved in treatment of our citizens. Turkey, of course, and one benefit here is visa-free regime of traveling, no language barrier. And actually, you don't need to undergo any bureaucratic procedure if you stay here for 14 days. And then if you get some papers after 14 days of stay, then you can stay up to 90 days without any problems, and it can allow you to undergo any treatment you need. We become aware that not all agencies from Azerbaijan have a comprehensive package of information about St. Petersburg. St. Petersburg has always been considered as a city of the Hermitage Museum or beautiful suburbs, but it hasn't been known for any other purposes. But luckily, the delegation of St. Petersburg attended Baku in April and participated in the travel and tourism fair. It means our tourism agencies got acquainted, and some new ties were established, and we solved the main problem actually. Why should our people visit St. Petersburg? And they actually got an answer to this question. So they were demonstrated that the city is not only proud of the Hermitage and other sites. Well, the great architecture and other things go without saying, but you can also come here for food tourism. You can also come here for special Muslim-friendly programs, because that's also interesting for our citizens. Halal food, specific Muslim diet. So that means we can cooperate and we can strengthen and we can increase the flow of tourists from Azerbaijan to St. Petersburg. While it is very unfortunate that the delegation of St. Petersburg came to us for the first time. We wanted to host them before, but there were different problems also connected to the pandemic. But in April, we enjoyed the event very much, and we got acquainted with St. Petersburg very well when the delegation visited us. As I mentioned, the growth of traffic between Baku and St. Petersburg airports shows 11% growth. So it's not a small number. Well, of course, there are some people who come here to visit their family members, but anyway, inside and or within these 18%, there are people who come here to get treatments. And this is, again, cardiology and oncology as primarily goals for treatment. Well, medical tourism between our countries, what should we do here? So what should the associations and the agencies do? So there are some contracts, there are some agreements between associations and agencies about some practical cooperation, which will not be just on paper, but in the real life. And we must maintain the leading role of health tourism. Well, a mechanism is, of course, required, but we must develop it and go this way. The second important thing here is promotion of innovations in health tourism, health and wellness tourism. We have been explained what the demand is, and thanks goes to them. But getting acquainted and contacts between our agencies and your innovations is the key. As I told you before, the information on health treatments between our countries is insufficient. It means almost that a person, a guest, him or herself, must contact the clinic and get all information. But here we must step in and organize this process on behalf of the association so that we can place the information on all websites, and each person who needs these services, the medical services, can easily find information and contact the institution. And 3 requirements to the infrastructure. 4, best practices from the point of view of legislation, following all laws. Of course, many laws are difficult, so we must know them well. And I would also refer to one of the recent speakers. The safety and guarantees are the key. A person must be confident coming to our country or to your country and be 100% sure that he or she will get help and that he or she is protected from the legal point of view so that we can avoid any problems. 5, to develop a joint actions mechanism and to develop a working style for health tourism. And 6 is all about marketing strategy on health tourism, and it will lead to more fruitful cooperation between our 2 countries. I would like to thank you once again for having me here. Thank you very much.
Emil, thank you very much for your informative speech. In my turn, I would like to add that St. Petersburg Agency for Medical Tourism, with the support of the Tourism Development Committee, has issued a catalogue that comprises all the information. I will hand it over to you. This catalogue includes more than 48 clinics and health resorts in St. Petersburg, including those representing public domain and private sector. We will hand over this catalogue, both in hard copy and soft copy, and you can upload the digital format on your website so that you can attract more tourists. I would like to give the floor to our next speaker now, Van Xiaohun, who will speak about the interaction of medical organizations of Russia and China as a prerequisite, as a necessary condition for the development of medical tourism. The floor is yours. Good afternoon. My name is Wang Xiaokun. For more than 20 years, I have been into this medicine. We have a family of medical professionals. Right now, I'm more focused on business, and I'm writing a book on medicine. I have many practicing doctors as friends who are active in different areas of medicine in leading clinics across China. And those who want to work hand in glove with colleagues from Russia. One of the most passionate colleagues I know is Dr. Jan van Doon. I have known him for many decades, and I have been keeping an eye on his medical career. We are close friends. Regrettably, he was not able to come to this forum, but he asked me to present something on his behalf and on the behalf of his colleagues. So his welcoming speech is in the slide, and I'm glad to be able to show it to you. This slide shows the core areas of diagnosis and treatment this Dr. Jan van Doon is working on. He has his own methods. He's teaching them in different institutions and universities. From our point of view, there is a huge potential of interaction between Russian and Chinese health institutions. If the required structural action is taken, they can form a solid influx of people from both countries who would be eager to get medical treatment abroad. Our countries will be thus able to get more progress, and the best results will be achieved through the development of medical tourism, which will improve health services for people living in both of our countries. For this project to succeed, we have all the required prerequisites in place. Russia has a well-developed healthcare system like China, and there are public systems for support of healthcare systems. In Russia, it is a national health support system. The leaderships of both countries are providing enough of financial resources, and they are allocating a substantial share of GDP for these purposes. Russia and China both have world-class health centers that facilitate the gradual development of health technologies. They are further put into practice, medical practice, across all the healthcare institutions nationwide. Russia and China have one of the fastest growing markets, healthcare markets across the world. The governments continue their investment in ensuring safe, efficient, and accessible healthcare to its people. Starting from 2015, the amount of increase of support, of financial support for these areas is 9.5% per annum. We can see an increased demand for healthcare services. And it is even increasing further by 10.6% per year. This increasing demand for healthcare services actually pushes forward, propels health tourism. Traditional Chinese medicine is still widely popular, both among people and professional doctors and physicians. China has also made considerable headway in fundamental healthcare disciplines, judging by the number of quotation rates. In 2000, the number of quotations put it in the 22nd position. In 2000, as I've already said, pushing it up to the 2nd place sometime later. Another important area is the development of vaccines and treating diseases. The pivotal factor that determines the high potential of Russian and Chinese clinics. And of course, general political relations between China and Russia provide favorable conditions. Strengthening these relations, improving strategic partnership, they all usher us in a new epoch of relationship. We know this from the visit of our president, China's president, to Moscow at the invitation of the Russian president, Vladimir Putin, in March 2023. This statement by the Chinese president claimed that parties will strengthen collaboration in healthcare and further expand relations in research and medical education. Both parties will extend their collaboration in terms of promoting favorable political conditions. It is thus apparent that there is an enormous potential for collaboration between our countries as far as medicine and health tourism is concerned. So as to further promote this tourism between our countries, we need to have established links at the level of healthcare institutions in both countries. We also need to acknowledge that we are still lacking links of this kind. The negative role was played by the COVID-19 pandemic, actually, which interrupted, put on hold, our bilateral relations. But anyway, I am sure that these links will be re-established in the shortest possible terms. Therefore, we need to both focus our efforts on this goal, find the relevant professionals, enterprising individuals. There are people like that, and I represent them here. First of all, we need to find reliable sources of information for healthcare institutions dealing with rehabilitation and treatment of specific diseases. We need to find out their capacities, their financial capacities as well. Another point is to develop their workflow, operational workflow, according to which they are capable of providing medical services. Another point is creating a standardized package of healthcare services which would serve as a foundation for more personalized services for our clients. Moreover, it is important to say that different sorts of services have to be provided to medical tourists, like accommodation, transportation, translation services, and other aspects that all come into play. We should be aware that medical tourism will only gain momentum when clients located in the other country are fully aware of the packages of services that are available to them and all the conditions they will find themselves in, so that they have the required communication channels with the organizers, just in case. Saint Petersburg has a number of remarkable institutions, a multitude of institutions that we would like to establish good contacts with, and this is just some of them, a small selection of many. You may have noticed that in the previous slide, St. Petersburg institutions were mentioned, and it's not a coincidence. We believe that St. Petersburg is a perfect match for us to start concerted efforts. This slide outlines the advantages of the city, which can lay the groundwork for a successful start of our programs. Thank you very much, and we will do a lot if we work together. Thank you.
Thank you very much. One more thank for speaking Russian when presenting. It was amazing. Thank you very much. Now I would like to give the floor to our next speaker, who is Saulesh Kalinova. Please, the floor is yours. If you need a remote control, it's here. Okay, I need a clicker, actually. I must apologize in advance because I can cough, but when listening to our distinguished speakers before our session, I realized that tomorrow I must abandon the idea of going to museums. I'd rather go to the forest to breathe forest air for a bit to treat my bronchitis. Okay, dear colleagues, having listened to the representatives of Kazakhstan, in particular, as a person from science, I would like to distinguish two different things, because, okay, some people tend to mix up, well, not mix up, but people often refer to health and wellness tourism. On the one hand, there is no contradiction on the surface, because if a person undergoes some surgery, he will also need some rehabilitation. Well, but medical tourism, health tourism in Kazakhstan is considered an organization which offers services for a person who gets treatment beyond the borders of the own country or the country of residence. So that's why it's also mixed in statistics, because, for example, when hospitals count some foreigners as medical tourists, they sometimes mix them up with people working in Kazakhstan. So we must be certain here. We must be precise here. A medical tourist, a health tourist, is a person who comes to Kazakhstan to get treatment, and also then he or she can also become a tourist. So, okay, the first thing I will touch upon today is diagnosis, and then treatment. And now, of course, we have a lot of requests about active lifespan, and here Russian tourists are the most active actors of modern technologies. That's why I think that our medical practitioners will come here to Russia to learn from you. Okay, statistics. Well, now we know what medical health tourism is. But the statistics is also inconsistent. Someone refers to one figure, the other one refers to another figure. But that's why, because the definition of medical tourism is vague. And UN WTO, which collects statistics, receives statistics not from all countries. Like, for example, yesterday when we entered the country, we were asked, why are you coming to Russia? And we just told them, okay, I'm going to a conference. But there is no statistics available on what kind of conference we're attending, what kind of directions we are following as tourists. So that's why it's quite difficult to calculate the exact number of medical tourists. The OECD writes that annual turnover of medical tourists is about 50 million people per year. But Medical Travel Journal, which is a very well-established journal, they say no, it's not right. 30 million would be a valid figure. Okay, if we consider the scope of services provided, it's not a bad figure, actually. As you can see, it's about $700 billion. The forecast for medical or health tourism development is better than for general tourism. As you can see here, 15-25%. Well, COVID played its role, of course. But I think that we can keep abreast anyway. While Google, which is curious, registered every day 138 million requests on medical tourism information. That's why more than 50 countries in the world put medical or health tourism as their first priority, because it actually means great revenues for a country. And here you can see a graph where all actors of medical tourism are represented. So medical health tourism is something in between, like doctors and tourism agencies. And here we have some difficulties. When we started to address health tourism issues, like we realized that medical doctors don't have time to get involved in the medical tourism issues. Well, of course, it's not possible for a doctor, for a practicing doctor, to work with tourism. Well, okay, agencies, hotels, insurance companies, of course, they must support the medical institutions in this respect. And here I think that we have the same problem. Tourism agencies ask what profit they will get for this tourism. So they require, or they ask for at least 10% of income from medical institutions, and the medical institutions don't understand why they should share. And well, here we come to another saying. So why do we or you host tourists? Well, first of all, a high level of medical services. A great bunch of people, when asked, say, when asked where they're going to get treatment, they mention Moscow, Saint Petersburg. And there are norms adopted in the legislation. Touristic services are stipulated in the legislation. If we read news about Russia, we see that you are developing a tourism very well, and we must learn from you. As for the treatment prices, the prices are very okay in terms of the quality and accessibility. And well, in some countries, people may have insurance, like, for example, in Great Britain, a person may have an insurance, but he or she must be placed on the waiting list and wait for a long time, and they may, by the way, die during this period. So, and that's why some people tend to leave their countries to get treatment. And that's why they also come to Kazakhstan. They can't wait. So these are the main reasons for trips. Like about 63% of the market are outbound tourists from the United States, Canada, Great Britain, Austria, Germany, Japan, low-cost, modern medical technologies, qualified medical help, time, anonymity. By the way, all these are factors predetermining their choice. And there is actually a legal ban on some medical procedures in some countries. And that's where we can step in. Kazakhstan and Russia, that's where we can receive medical tourists. We have done some surveys, and with regard to Kazakhstan, I can say that when people go abroad, our citizens prefer Germany, Switzerland, South Korea, Czech Republic, and Turkey. But what are the cons? High prices, of course, difficulties in communication. When I went to Germany 4 years ago and underwent a checkup, and I paid more than $1,000 to an interpreter. And today I was enjoying the session because everything is clear. I can understand everything which is being said, and that's great to speak a common language. Mentality, a difference in mentality when you go abroad. So we have slightly different mentality here within the CIS countries. While it's effort-consuming because you need to do your research, you need to find a clinic and so on, high transport costs. Well, if you fly to Moscow, even if we don't have any direct flight to Saint Petersburg, so we had to fly to Moscow. But I hope we will come back to having a direct flight between our Saint Petersburg and Kazakhstan. And of course, accommodation is expensive abroad. I think that you have very good prices in the hotels. Kazakhstan hotels feature higher prices. But if we speak about European countries, for example, the prices for hotels are very high. Attractiveness of health tourism for CIS citizens. So the tourism has been developing between the countries. Well, as it was mentioned, no language barrier, geographical proximity. When you consider how to travel, you can see that it's quite close in terms of distance. Okay, visa-free regime, and we have now abandoned the visa regime between Kazakhstan and China. Before COVID, we wanted to go to China, but we were notified that we wouldn't be able to get a visa. But it became much easier, so we can use our ID to travel to. The citizens of CIS countries show demand on cardiovascular surgery, transplantation, of course, maternity ward, neurosurgery, plastic surgery. It hasn't been mentioned yet today, but it's proud of a very high level. And as for the standardization, so what I heard today, so here is a standard Joint Commission International. So in Kazakhstan, 7 clinics are accredited for this standard. The information may be outdated, but I think that in Russia, not many clinics follow this standard. But why am I saying that? If a foreign tourist want to come to a country, they might search for clinics having this JCI standard. Marketing. I think in terms of marketing, we share the same problems, Kazakhstan and Russia. What can be said here? Medical organizations, medical institutions don't have any time to get involved into marketing. Tour operators also face problems with that. So that's why there are some special medical tourism operators which can do this work. So when we speak to Kazakhstan clinics, hospitals, that's what they say. They have, okay, we have a website, and I argue your guests cannot read it. You may not have it in a foreign language. So, like, how can you get information in English or French or whatever? So, Yulia, thank you. You told us today that there are clinics here that you want to promote, and that's a great effort, actually. Well, what else can the institutions say? They say, okay, we have our marketing specialists. What is my counter-argument? Well, great, but you pay them a salary. But if you pay an agency, you can save and promote your institution. Okay, some medical hospitals say, okay, we have interpreters in our staff, but my counter-argument would be, but it's, well, first of all, you need a variety of languages available. So that's why you can contact some medical tourist operators for interpreters. Okay, what else can medical institutions say? They can say, okay, we have a call center, and we can accommodate a patient ourselves. Say why? But my counter-argument is why? Why should you do it? Why should you bother with accommodating a patient? Because it's a time and effort-consuming procedure. What else? An institution, a medical institution can say, okay, I can come to fairs and events and promote our clinic. I say, okay, that's great, but you can find an organization and delegate this promotion to this organization. What else can I add here? Generally, speaking about medical tourism operators, they should, of course, organize events, roadshows, TV ads, press ads, while even some information leaflet at airports. That's a great step to promote, even if it's simple. Of course, on-the-job personal training, because health tourism is not just to welcome a foreign guest. You are hosting a real person, and he or she has a lot of expectations about the treatment and its outcomes. Then again, partner relationships with international organizations in healthcare, workshop, master classes to promote the achievements of the country. So today I heard several presentations, and I got very well informed about how they work. And in the morning, I could get a picture of who can come to you, whom I can send to you. And that's thanks to being here and listening to the colleagues in this event. Well, of course, nobody is saying that it's just charity. Colleagues, but if you don't participate in charity, And if you don't promote your participation in charity, you will not be able to develop health tourism properly. Okay, and what should be done to promote domestic medical services? Here we have problems on the left and solutions on the right. So in Kazakhstan, we don't have any unified database of medical institutions ready to provide the foreign citizens with medical services. We have some scattered information pieces, but they're not put together in a database. But foreign citizens will not search for a specific clinic. A foreign person, that's their mentality. They will search for an association who unites some clinics. What else? No marketing surveys of the image of medical clinics, hospitals among the population in the country. I don't know if you conduct such surveys in Russia. Well, I think I heard one case, but actually it would be right for the Ministry of Healthcare to get this information, get interested in this information. That's why. And then we can also give recommendations which clinics can be involved in hosting foreign guests. What else? There are no marketing surveys among foreign citizens to know specific needs, what exactly they want to get in terms of medical services. Okay, next, no comprehensive comparison of pricing policy. I think that's the worst part here. Pricing policy, well, there is always a range from 1,000 rubles to 10,000 rubles, for example. But we must be able to understand more or less what a clinic offers the patients. So when if this comprehensive comparison can be displayed, for example, on a website for foreign students, then it will be easier to get an inbound flow of medical tourists. What else? Partnerships with foreign companies, they're quite often unilateral. While I do understand that anyone wants to promote themselves, but I want to stress that partnership must be bilateral and mutual. That's what gives us a win-win situation. Well, here, no marketing culture of continuous promotion of the services on the internet platforms. I noticed that on the one hand, some services are being marketed, but our clinics lag behind in updating the information. Well, that's probably the problem of the marketologists, but if I go through websites of clinics, sometimes I can't find this information. Okay, and here you can see prospective directions of health tourism of Russia and Kazakhstan. It was already mentioned before, and some recommendations that this slide features. International accreditation, JCI, improved medical services and logistics, building a touristic image. Well, in Russia, we usually say like tourisический in Russian, which has its equivalent in Kazakhstan Russian in accordance with the legislation. And I was pleased to hear from the colleague from Azerbaijan that the state compensates up to 50% of some costs, but we on our side are still speaking about promotion and compensation, but we haven't even approached the solution. But I do hope that in Kazakhstan we'll have the same policy. But well, having this forum, for example, having this event is a great contribution to promotion of Russia. private investors, medical staff and foreign languages, like, well, of course, you can rely on an interpreter, but maybe you may want to teach medical staff some basics of foreign languages. Okay, we'll have this list available. I'm really sorry, we have problems with this route. And here is the coordination pattern, and I would like to thank you for your attention.
Thank you very much for your informative speech, which gives us a lot of food for thought. Today, together with colleagues, we've spoken a lot about health tourism in Kazakhstan, China, Azerbaijan, Kyrgyzstan, Uzbekistan. Thank you very much, colleagues, for finding time and sharing your invaluable experience in health tourism and shared insights on how this is happening in your countries. To pick up the topic of this tourism sector, I would like to now show you the video from one of the experts from India, leading expert in health tourism, Dr. Prem Jagasi, will speak about how to make a startup from scratch, from an idea to success in medical tourism. So we are now ready to start the video.
You do need to create a stunning business plan. Have you ever got a chance to create a business plan? Not really, right? First, talk about summary. What is your business all about? Minimal summary, minimum word, exciting objective, exciting action, exciting information. And use artificial intelligence, by the way. Use ChatGPT to write your summary and talk about future overview. Do not talk about right now necessarily. Talk first about the future overview, because even investor is looking for the future, isn't it? The investor himself is interested in the future. So you are communicating with a person who's already interested in the future. That's why he's investing in your company. If the person doesn't look on the future, he's not going to invest money. If he is satisfied with where he is and he has the money, he will put in a fixed deposit or with him. He will never invest. Investor means someone who's looking for the future of it. So his intention is to look at the future vision. So you have to provide the future vision with a strategy and with a roadmap. A strategy, which means a clear plan. Whatever we discussed today, you need to put down that strategy. How you will identify target market, how you will get the patient through the referral marketing, through the paid advertisement, through the online reputation. That is strategy. And then roadmap, how you will do the touch point and all. Then talk about the various business plan you have, operational plan, how you will succeed, how you will compete, how you will grow in operational plan of the business, because it's extremely important to discuss those fine details about why things will happen perfectly all right with your business planning, and what will be your strategic plan and what will be your tactical plan. Strategy is a long term, tactic is something which you deal immediate basis on something on the short term, right? And then you need a business plan to do all these things, to establish business milestone, to create effective growth strategy, to determine your feasibility and financial needs, to better understand your customer, your competition, everything to put in terms of one business plan to help you grow. If you do not put all these things, all these elements, then you're not going to grow in any way. And then all these are essential components like execution summary, executive summary, vision, mission, your target market analysis, your destination evaluation, your USP, and all those things. And my humble suggestion is that add wellness component into the business plan, because that's a beautiful component, and then create a wonderful report with the projection, and have a financial projection which provide the massive benefit to the user to the investor that who can actually value your financial, and help you giving cash, help you giving revenue, help you giving money, help you manage your, getting resources, help you execute your plans. So you require lots of expenses, by the way, in the projections. You need to clearly mention what is going to be your capital expenses to have an office, furniture, and all those things. You need to mention your operational expenses. You need to mention the revenue 1, revenue 2, revenue 3. In the worst case scenario, in a good scenario, in a bad scenario, what is going to happen, all those things. Your financial revenue models needs to be there. If the financial models are not comprehensively done, business plans are not going to work very well. Talking about revenue, talking about projection, that is the key element, what you're going to give on a return on the investment. And then you talk about the business strategies, and then look at the future. And always talk from investor perspective, not that you need investment. You need to talk the investor that you need to invest in this industry, otherwise you losing out, not me. If you do not invest in business, you are losing out. I am perfectly all right. That's the tone you have to set to catch the investor.
Dear colleagues, we are coming to the end of our session. I would like to thank you all for finding time and staying here with us until the end of the session. I would like to invite you to the coffee break, which is served in the next hall. We have a 30-minute break, and our session will recommence. Thank you very much, and looking forward to see you.
Отлично, звук уже есть. Дорогие коллеги,
Dear colleagues, I would like to thank you for coming to our third session today. I do understand that you must be tired by now, but I hope that after the coffee break you feel a little bit more energetic. You have had some rest. The third session, I suppose, is going to be the most tough and intense in terms of discussion, most gripping, riveting, because we are going to speak about the countries of Middle East, and we are going to speak about the medical tools and instruments that will allow us to enter these markets. And our colleagues will tell about their vision, their experience, their philosophy of going into the markets of wellness and medical tourism in these countries. And also, we shall discuss interaction between these Oriental states and Russia about different approaches in cooperation. I suppose that I can invite the first speaker, who will speak about different instruments and tools of entering the market, the Vice President of the Commerce Chamber of Saint Petersburg, Ms. Lebedeva. Good afternoon, dear colleagues. I will not beat about the bush, because here we have representatives of the countries and states, the markets that are of interest to us today. So I will probably give you just general recommendations. If you are already experienced on international markets, I suppose that you use these tools already, that you are familiar with them, but I will draw your attention to a couple of important aspects. We do understand today that we are reorienting. We have friendly and unfriendly countries and states. And if we speak about medical tourism, then I suppose that the most active cooperation will be with the neighboring adjacent states, which are the CIS states. But also, I suppose that nowadays, for our medical facilities, we have a window of opportunities in terms of attracting new clients from new friendly countries. So what is the main issue? The main issue is that nobody knows anything about us. For example, Russia can be perceived as an industrial country, like Saint Petersburg can be perceived as such, and probably a center of new technology. But when we speak about medical tourism, we are not in the scope of attention, because information is really lacking. We lack information about good facilities, good settings, and qualified specialists and staff working in them. We're speaking about Middle East at the moment. This means that we have a myriad of completely different cultures and countries. Here we have representatives of several countries. We should understand that the mentality differ greatly in them. These are different patients with different problems. And we should understand that working with such patients, providing services for these markets, most probably you will have to modify your processes, to change your procedures in order to adjust your services to their markets. If you want to work with international markets, you have to work on a whole strategy. It should not be done at random. It must be a system. I'll give you an example. When we spoke about attracting tourists from Middle East, from the Persian Gulf countries, for instance, we bumped into the following situation. Not all of our city facilities, like hotels, even five-star hotels, are ready to cover their needs and necessities, because they come in summer, they have big families, they need particular facilities, like suites, for example, and not all of the hotels were ready to change, to modify for their needs and necessities. And we do understand that these are affluent tourists. If you move on and start speaking about the instruments that will facilitate starting to get to know more about the markets, and also facilitate providing information about your services internationally. I represent here the Chamber of Commerce, and we have a number of medical and tourist companies that are affiliated to our chamber, and also I assist them greatly. But there is an aspect, if we speak about business culture, I suppose in the East, just like here in Russia, personal contact would be top important with your partner, because you need to have a cup of tea. You have to chat over a cup of tea before you start doing business. So remote online business will be almost not possible. You need good, effective contact first. I also represent business units, and I would like to say that we organize a great number of meetings with our international partners. I should say that if we look at Africa, Latin America, Middle East, many partners are very positive towards cooperation with Russia. They demonstrate keen interest when it comes to different goods and services and new technology. But on the other hand, they do not look at our country as a provider of medical services. So I can say that previously we were importers of such medical services, and there were many presentations of our foreign colleagues. Now we're going to become exporters of such services. So we actually need to be part of associations of medical tourism, because we have a great deal of different types of meetings, events, workshops, educational events, which are definitely open, free of charge, and they're all about international communication. That's a good support. Also, I won't speak long about the support measures, but I do recommend some of them. There is a gap. All the expert support measures are targeted at production companies, the companies that produce something, manufacture something, although exporting services is one of the priorities, and it is also stated within the national project. So I would recommend you to look at these structures. There are two structures. Russian Export Center, this is a federal structure or organization. And at the regional level, we also have bodies. In every region, we have an export center. Our export center also organized business missions. So what programs are available? You need to browse and see. There are other support tools that you can also utilize and enjoy. In conclusion, I would like to say that it is important to come out in these markets. It's important to promote our medical settings and organizations in these markets. We have decent level at the moment, and I suppose that the prices, the values are quite competitive. What you will face definitely is that you will need to overcome some sort of prejudice, because we do understand what sort of information background there is about our country. And definitely you need to understand how the payment will be done, because at the moment there are certain problems with the financial difficulties with the international organizations, because the banking sector suffers from sanctions the most. You should be thinking about it. Also, you must have good contracts. You should definitely hedge all the risks. That's why you need to invite a good lawyer who understands what medical tourism is about and what international medical services are. All your materials must be also translated and adapted towards the market you are going to enter. Also, one of the mistakes that is frequently made, for example, when it comes to Arabic language, it is read left to right or right to left. We have pictures, for example. We have a picture how it was bad, and then on the right there is a picture about how it turns to be good after a person comes to your organization, but it will be perceived differently by an Arabic person because he reads from the right to the left. All your materials must be adapted. This is one of the examples. The markets are quite complicated, difficult. All the countries are different in terms of mentality and culture and the business environment as well. So you must be, first of all, knowledgeable about these markets. You must understand the mentality, and you must trust. But you must be cautious when you find partners. These are basic recommendations for any organization, disregarding the fact whether it is exporting goods or services. Thank you for your attention, and I would like to pass the microphone now to the representatives from the region, how they see our potential. Thank you very much. Thank you, Catherine. You have given us such a myriad of instructions, but on the other hand, they were so clear-cut and precise. You talked also about the support of the state, and you have drawn our attention to the peculiar features of the Oriental state. So our next speaker, Nurdakok, will be speaking about the same issue, but from the side of Turkey. How you manage to create this good relationship between business and the state. So Medical and Current B2B organization, he's the head of this organization, but now he's going to speak about the business and state interactions.
Do you mind if I take the bench?
Yes, it will.
Thank you very much for the introduction, for the invitation. Dear colleagues, medical tourism professionals, you may need translators. I'm going to speak in English. Okay, sure. I should wait for a few moments.
Можно взять, если у кого-то еще нет переводчика, возьмите, пожалуйста, работает в зале переводчик, возьмите, пожалуйста, аппаратуру. Так, ждем тогда минуточку.
Yeah, this looks like a protest. People are leaving the room when I'm speaking, but I know they will be back with their headsets.
Yes, of course.
I haven't said anything bad yet. So, at the meantime, let me introduce myself to English-speaking colleagues in this room. My name is Mert Akkok. My company is called B2B Medical Encounters. It's a network of medical tourism professionals. The company is based in Turkey, Istanbul, but we are pretty international. We have more clients in Europe than in Turkey. We represent Spanish cluster of medical tourism. We work two of the main leading hospital groups of Italy. We did consultancy programs and events for an Israeli governmental organization called Clalit. That's a public healthcare organization, like a public umbrella for public hospitals. So my experience is based on different countries, and of course, I live in Turkey, and we work with Turkish hospitals and clinics who perform medical tourism. Turkey is something like the laboratory of medical tourism for the past 10 years, because Turkish Ministry of Trade has a support program for medical tourism, which can be a good example for the Russian government representatives here. They subsidize, they reimburse up to 70% of the marketing expenses of Turkish clinics when they do advertisement abroad, when they go and sponsor events abroad, when they organize events themselves. The money they spend for marketing, 70% of it they can get back from the Turkish Ministry of Trade. So this is a great opportunity. This gives the possibility to Turkish clinics to do a lot of marketing, to try creative methods of marketing, Sometimes stupid methods of marketing, because they don't spend all the money themselves. Let's say they advertise in a country which is not very likely to send patients to Turkish clinics, but they can still spend a lot of money because in the end, actually, they spend 30% of it. All these methods, destinations, markets has given a lot of experience to Turkish clinics about what to do, what works, what does not work. And I have been in the middle of all these attempts. I have observed what methods work in which country, what methods don't. Okay, now that everybody is back with their headsets, I can start my actual presentation. Up to now, it was just the teaser, the introduction. Okay, so not only in medical tourism, in all businesses, there are three mainstream marketing methods. Business to consumer, which B2C. In this kind of marketing, your target is the consumer. Let's say the patient, when we are talking about healthcare, your marketing targets the patient. Business to business marketing, in this category of marketing, your target is another professional company. So it's two commercial entities doing business with each other. B2G, business to government marketing, your target is a public authority in a different country, or in your country sometimes. Of course, there are multiple other methods, many other methods of marketing, but these are the three mainstream methods for marketing your services or products. So medical tourism is like an ideal match of B2B, B2C, and B2G marketing. There is place for all three types of marketing in medical tourism. I and my company, we specialize in B2B marketing, but today I'm going to talk about business to government marketing. Here are the known methods of known instruments used by different marketing methods. But for governmental marketing, I will start with some brainstorming because I know that the colleagues in this room, the audience in this room, consists of some Russian medical tourism professionals who want to attract foreign patients from different countries. So in business to government industries, please do not expect quick results. It may take too long to get into some agreements with some governments. Whereas, in some cases, there are very quick results. I'm going to come back to this later. Countries like Iraq or Bahrain or Qatar, they have governmental tenders for medical tourism cooperation. These are very quick results. But they may change very easily. They may get canceled very easily. Do not depend on the contract you have with them. Payments are usually a problem when you do business with governments. They never pay in advance. It's not like professional company cooperation. They give you a guarantee of payment from a bank of their country, and it may usually delay to receive the patient. A lot of documentation and paperwork, a lot of bureaucracy is involved. So let me give some examples. I know you have this question in your mind. Which countries send patients governmentally? In which countries is this opportunity available? Mainly Middle East. There are two reasons or two categories of countries who provide B2G medical tourists. Either very poor Middle Eastern countries or very rich Middle Eastern countries for different reasons. The first category, because they don't have the infrastructure and means to, they don't have the resources to invest in medical technology. Am I too fast for the translator? Okay, all right.
Maybe a bit.
Okay, thank you. The second category, let me give you an example. Bahrain, I still work in Bahrain with Bahraini Ministry of Health. I do projects for them. It's a small Gulf country. It has petrol and aluminum. It's a rich country, but it has a very small population. So for the government of Bahrain, it's not very logical to spend a lot of money to invest in technology sometimes. Let me deepen the example. Proton therapy, which is available in Russia, which is not available in Bahrain. It's very expensive. But Bahrain has the money to invest in this technology. But for those who don't know, proton therapy is an advanced oncology treatment method, a technology. It requires an investment around 35 million euros. Russia has many proton therapy centers. Nobody knows about it. People in Turkey don't know about it. People in Spain don't know about it. They come to Russia to invite patients for proton therapy in Spain. They don't know that Russia has more proton therapy centers than Spain. Spain has only one. Russia, I think, has more than 8 or 9, I don't know. Anyway, so Bahrain can actually invest in this technology, but their population is so small, so it's not logical. They may need this technology for only a few patients a year. To maintain this technology, not the initial investment, also to maintain the maintenance of this center is too expensive and inefficient for a government. So they prefer to send those few patients abroad to a different country where this technology is available. And they have a department for this in their Ministry of Health. They usually call it, in most of the Middle Eastern countries, this department is usually named Overseas Department. Healthcare Ministry's Overseas Department. So the motto, the duty of this department is to find solutions abroad, healthcare solutions abroad, for their local patients, to send patients abroad. There is a manager, a director of this department, who is constantly looking for medical solutions abroad. Russia can go to Bahrain. There are direct flights from Bahrain to Russia. There are many doctors who studied in Russia and currently working in Bahrain. So these are tips. Usually, business to government medical tourism comes from countries where you have direct flights, not only, but mostly, and where there is a number of Russian-speaking doctors available. These are the main brand advocates of you. Saudi Arabia, Kuwait, Qatar, these countries have medical offices in Germany, United Kingdom, and USA. These countries, they are very expensive in medicine. They are not any better than Russian medicine. But for some years, they had the reputation and cooperation, governmental cooperation. So the governments open foreign missions, like medical attaché offices in these countries, because the Ministry of Health of these countries, they send patients to private clinics in these countries, and they need someone to follow up with the patients. And they get treated in public hospitals in Germany. Not, Saudi Arabian patients, Kuwaiti patients, there's always this wrong perception. We think, most of the people believe, these kind of patients, they look for luxury private healthcare. No, they get healthcare in public hospitals, but a good healthcare. But they are managed by a local office in that country. So here you need your government's support, but you should invite friendly Middle Eastern countries and North African countries to open such bureaus in Russia. These will be, they may need time, it may take time, but in the end, they are going to start a B2G business to public and private hospitals in Russia. On the other hand, there are countries like Iraq, Palestine. They lack the medical technology, or they lacked well-educated doctors. In the Middle East and in North Africa, and in some other, not only North Africa, in whole Africa, there is usually advanced medical education. Good, reputable medical education is not available. So the medical students, young people from these countries, they go abroad to study medicine. And they usually stay there, because a doctor needs a team. Even if a doctor is idealistic and he wants to come back home and perform surgeries at home, he doesn't have the team of other doctors and physicians and nurses and the hospital managers. So he usually stays abroad. So these countries also lack medical personnel, medical staff. This is another method of B2G cooperation. You can initiate training programs. After, what do you call them? After graduation medical education. Continuous medical education programs for young doctors from those countries. They don't necessarily have to speak Russian, but you can send your experts, you can invite their young doctors and do non-profit medical education programs. They work. Usually, especially in Africa, they are so fed up with us demanding patients from them. But once you go and do a non-profit event, let's say free screening, free medical checkups, just eye ophthalmological checkups in an African country, you will not believe how big impact this will have in terms of PR on their government, not only people. I'm not talking about B2C marketing. I'm talking not consumers, but their government loves cooperation, non-profit cooperation, voluntary cooperation from other countries. Then they will start looking into B2G cooperation with you. But it's usually very hard to convince our bosses. If you are representing a private clinic, the boss wants quick results. Why should I invest, spend money, send my doctors abroad for nothing? I don't know how many patients I will get in 3 months. So this is more workable with public hospitals. They are not as commercialized as private hospitals. But I promise you, if you are patient enough to do some medical PR in a foreign country, it will end up with big lucrative business. Local presence is very important. Indian hospitals, they have many medical centers, diagnostic centers all over in Africa. In African countries, in some of the less developed African countries, diagnostics is a problem. They cannot diagnose the sickness. In some of the African countries, they don't even have the MR technology, magnetic resonance technology. So when we receive reports from those countries, the doctors usually ask for extra documents. We ask for a scan or MR. They don't have it. So even for simple cases, they go abroad for diagnosis. And then, I mean, if somebody has a headache, he needs to know if it's a tumor or if he needs new glasses, or if it's an ophthalmological problem. So even for this diagnosis, he goes to France. If it's a Francophone African country or an Anglophone African country, they go to UK for diagnosis. Now they started coming to Turkey, which is cheaper, and they don't need visa for Turkey. And after the diagnosis, they usually stay in that country for the treatment. So Indian hospitals use this as an opportunity. They have diagnostic centers all over in Africa. They lose money. These diagnostic centers, they don't profit. But it's a perfect marketing. They take their old technology, old machinery from India to Africa. They just have a laboratory and a diagnostic center. They diagnose. And if the patient needs a surgery, they refer the patient to India. So if you talk about this to a hospital owner, they will use it unnecessary or unfruitful business to employ someone in Africa to pay the rents for a few years for nothing, to transfer the technology. That's not effective. That doesn't look effective, but it's better than spending hundreds of thousands of dollars on YouTube or on Google. Social media marketing, digital marketing is now very expensive. Why? Because Turkish clinics have the money from the Turkish government, and they spend all the money on Google advertising, and this increases the prices. Because digital marketing is like a stock market. If more people advertise, the prices go up. They don't have fixed prices. So medical marketing on digital media is getting more and more expensive because the Turkish hospitals and because of the Turkish Ministry of Trade. It may stop, but for now, advertising on Google is very expensive. Or I don't know how it is on Yandex, but I also don't know how widespread is Yandex in Africa and Middle East. Google is. Okay.
Спасибо за такие чудесные комментарии. На самом деле, действительно очень много
Care
интересного.
for these comments. It's very interesting that you have been talking about. I'd like to step in your dialogue. In 2016, I was in the exhibition in Berlin where Turkish government presented medical tourism. They held exposition in a pavilion, medical tourism in Turkey, and everybody understood that now Turkish Turkey is involved in health tourism and medical tourism. And now you are talking about this fact that the government helps to develop the medical tourism. And we are a bit envy to you on the one hand, but on the other hand, what's the another side of the coin, negative side of the coin? Can you talk about this?
This is a very difficult question to answer. So what are the disadvantages for clinics? None. I don't see, I mean, Turkish clinics benefit a lot from this support program. I can give this example. There are some birds near Canada. They eat fish, they feed on fish, and there are fishing farms, artificial fishing farms in that region. So these birds, for generations, they forget how to hunt for fish because fish is available in these farms and they can simply find it. They don't need to look for it. They don't need to catch it. For generations, this is a real story, by the way. For generations, these bird species have fed on these farms and they forgot how to hunt. And when these fishing farms, artificial fishing farms, were closed, one of them went bankrupt, and they closed the fishing farms. These birds, they started dying because they didn't know how to hunt themselves. For many generations, they became lazy. So this is a potential risk for Turkish hospitals. When the government stops, because governmental programs have a duration, 10 years, 12 years, then they stop. When it is time for Turkish hospitals to market themselves, they won't be able to bear the cost that much. But on the other hand, even small to medium-sized clinics in Turkey now, they are making very good money from medical tourism. That's also because Turkey is almost a visa-free country. We can receive patients from Africa, from Middle East, from Russia, from Ukraine, from many different places. So even if now they stop the governmental support, I am sure medical tourism will survive. Not everyone, but some of them may.
Thank you.
On the other hand, visa is a big problem. That's a big problem for Russia too. Your embassies abroad are not always very helpful. They don't understand the concept of what we are trying to do here. Before pandemic, together with my dear colleague Evgeny, we tried to organize several medical tourism events. We tried to bring delegations from Middle Eastern countries, official governmental delegations, to Saint Petersburg and show them what we can do here. Even someone who works for the Iraqi government, and this lady was a doctor who is in charge of sending patients from Iraq, she couldn't get the visa from the Russian embassy in Iraq. I could barely get a tourist visa myself. They refused to give me a business visa. They asked me, so I had to get a tourist visa, and then on entry to Russia, I was questioned why I am here. I had to tell a lie. So that is a problem. Not only for bringing patients in, that's a bigger problem to bring patients. So you need to work on this medical visa, and it's not only convincing your Ministry of Health, it's not only about it. Your Ministry of Foreign Affairs should understand what we are trying to do, and you should also go personally, if you are the manager of a clinic and you want to bring patients from Saudi Arabia. Your marketing manager should personally go to Saudi Arabia, meet the Russian embassy there, meet with the commercial attaché there, and tell them, and ask for the direct mobile phone number of that person, and a second number, in case she is on holidays or he is on holidays. Because you will need, it won't be easy, it won't be simply sending an invitation and asking the patient to take care of his own visa. That won't work. I promise you, it won't work. Even to bring the person in charge of sending this patient, the insurance company, the paying fund, that person may even be denied a visa. So this is a threat waiting for you when you try to do B2G business. But I understand, I realize that Russia today is doing more B2G business with the CIS countries. Here visa is not a problem. Language is not a problem. Food is not a problem. In Middle East, you need to deal also with cultural problems like halal food, a lady patient being treated by a male doctor sometimes requires a lady translator in the room, things like that. But I think I'm talking about your future problems, not today's problems, but eventually Russia will focus on the patient sources in the Middle East. That's where the honey is, the honey pot is there. So these are the problems waiting for you ahead. I have spoken too long. I don't want to steal from my colleagues' time. Another example from Israel. Israel is getting a lot of foreign patients through embassies in their country. Let's say in Moscow, in Saint Petersburg, you have a consulate or an embassy in Moscow of Algeria. Go there. They can give you patients. They will give you patients. They are looking for, not only for their own staff, because these embassies also are in contact with big insurance companies or big corporations in their country who need medical solutions abroad when they need medical evacuations. Not only Russian ministries abroad, also foreign ministries in Russia will be your partners in this. Israel is getting a lot of African patients through ministries in Tel Aviv. Okay, I will come back to this. And also, there are some governmental funds in the Balkan countries, Serbia, Bosnia, Macedonia. These countries also send patients abroad funded by the government. So these can be other resources of patients. I have already mentioned these methods already. Last but not the least, each hospital has a modus operandi, a method of operation. You may need to change it. If you want to do business with foreign governments, you may need to adjust with what they need. You cannot simply say, oh, we do not provide translation. I'm sorry, then they do not give you the patients. Or you cannot say, oh, we get payment in advance. I'm sorry. Turkish clinics get a guarantee letter from a governmental bank of that country. Okay, you may not trust a governmental bank of Libya, but you may trust Qatar. You may trust Saudi Arabia. A public bank of Saudi Arabia, if they give you a guarantee of payment up to certain millions of dollars, if it is approved by the medical consul in that country, then you can get the patient, do the treatment, and then send the invoice and wait for the payment. It usually comes a bit late, but it comes in the end. But complications, medical complications are a problem. They usually don't want to pay for medical complications because before sending each patient, they get an offer, a quote from you, a quotation. In medicine, we all know, it's never like selling microphones, not selling items. After the surgery, a complication may occur, and the patient may need to spend 6 extra days in the intensive care units, and this is very expensive. But if this was not written in your pro forma invoice, in your offer, it will be rejected. So for this, you need to have a backup plan. I know methods. I know what Turkish hospitals and Israeli hospitals are doing, or Spanish hospitals are doing. It takes too long, but we can discuss about this. Okay, get help from your own government and embassies abroad. I have already mentioned this. And I would like to thank you for listening to me. If any questions, should I answer now or by the end of the session? No?
Have you questions? Have you any questions? No? No, thank you.
Thank you.
We will try to use your advices. We listen very...
Thank you. Спасибо.
Thank you very much, Murt. Это были очень полезные для нас советы.
The advice is precious for us, and now we will try to push our governmental agencies to get help from them to develop medical tourism in the Russian Federation and in St. Petersburg in particular. And the representative of the Chamber of Commerce was cautiously following the speech. We are, of course, not a governmental body, but anyway, as a business association, we have some authority to file recommendations. And why this session is specifically interesting, that's because there are a lot of issues and problems we don't actually understand from inside. For example, visas, but we must understand that patients may need more time for treatments, so visa issue must have some solution. And I hope that these kind of questions will be addressed by us, at least at the regional level, so that the issues are also transferred further to the state level, because we now see that there are some obstacles for tourism development. While we do have infrastructure, good professionals, but still there are some obstacles impeding us from further development. And thank you very much for this view from outside. It was really helpful. Well, as a matter of fact, St. Petersburg is a leading city in Russia for the visas, because electronic visas are introduced here. And we will try to continue this way, and we will probably try to do something, to do some efforts to get permission for electronic visas for tourists coming with medical purposes. And now I would like to give the floor to Nigar Asadova, who is representative head of the representative office of Florence Nightingale Clinics in the Russian Federation. And Mrs. Asadova can give us another view how to bring tourists to Russia, and in particular premium class tourists. Good afternoon. Good afternoon, dear ladies and gentlemen, dear colleagues. First and foremost, I would like to thank the committee, the Tourism Development Committee of St. Petersburg, for the invitation and the floor given at this International Health Forum. Briefly about myself, my name is Nigar Asadova. I'm a doctor by education, children's doctor, and I got an additional education in economy, internal control and audit. That's what my qualification reads. Now I'm the head of the representative office of Florence Nightingale Clinics in Moscow. We have an office in Moscow, and we have also a partner clinic. The clinic is named after academician Royberg. Just a couple of words about the group of hospitals Florence. Florence Healthcare, that's the name. There are 4 hospitals, 3 outpatient clinics in Istanbul and 1 in London. We have our own medical university, the Demiroglu Bilim University, which cooperates closely with the clinical research center and the Center of Excellence for introduce excellent research and development results from all over the world. And we specialize in many directions like neurosurgery, orthopedics, oncology, transplantation, spinal cord surgery, and other directions. Florence Healthcare serves about 70,000 inpatients and 250,000 outpatients. We have 804 patient beds and also intensive care units. Florence Healthcare boasts the rich experience of offering services to foreign clients. We've been accredited by Joint Commission International, ISO, and QHA trend. Today, I would like to share with you the information about how we in practice offer services to patients outside the country where the patient resides. Today, it's quite common to call it medical tourism. What does it mean? It means that, yes, patients go abroad, they leave the country for treatment, so they get treatment abroad. The main criteria which affects the choice of a hospital for a foreigner is something that we mentioned it in the previous session. So what is the main criteria to choose a hospital or a doctor? The main criterion is the international reputation of the doctor, professional experience, and confidence of the patients in this or that doctor, high qualification of the doctor, and high level of medical service, of course, has a role. It's not only a doctor, a single doctor, which is who is important, but also the high level of medical service. In most cases, it means that a doctor specializes in certain treatments or methods. And that's what makes leading professionals to cooperate closely with companies and other institutions, which helps them to implement the up-to-date and cutting-edge technologies in their work. So that's why it is crucial, important to work with very cutting-edge equipment, technologies, and treatment methods. Premium clinics include not only a high standard medical service, but also luxury hotels level service. As for foreign clients, they cover long distances to contact a hospital. Nowadays, more and more patients understand what good medical services look like. If patients feel they don't have enough of something, that their expectations are not met, they may, of course, consider different variants, different destinations. So to satisfy the clients, you must provide them with positive experience. Patient experience is important at any stage of the treatment, between admission and discharge. The experience, the patient's experience, is the patient's perception and feeling associated with it, which are related with cooperation and communication with the system as a whole and individual people. That's why the interaction of a patient and a hospital is a part of the patient's experience. That's not that easy as it seems. To provide the guest with the best possible service and positive experience is difficult and requires in-depth knowledge and skills. You must be able to provide quality and safety and service of the highest level. Besides, there are different related things like risk mitigation, confidentiality issues, and so on. Which standards, protocols, and services are being promoted within the framework with international standards? Standards of education and communication. The most important part is personal training. Personnel, both medical and non-medical, must be taught how to identify a patient's unique needs and how to meet them effectively. It varies, so it ranges between verbal and nonverbal communication to understanding the social, cultural aspects, and at the same time, you must demonstrate tolerance and respect to a patient. So there are a lot of aspects the medical staff must be aware of. Also, standards of understanding the culture of the patient. For example, correct diet is crucially important in treatment because correct diet, correct nutrition is crucial for example, treating post-operational wounds. So if we offer the same plan of nutrition to all patients, we may notice that in some patients, the results of treatment are worse. And for example, from our side, we can provide patients with a Muslim diet, like halal diet, instead of Western cuisine. Available and relevant protocols for coordination and safe transmission of personal and medical data. The medical secret is strictly observed. Patient data are digitalized. Yes, just a small digression here. I would like to mention one case when in Florence, all confidential information is stored in the hospital's system, and even during the earthquake, it looks like an in-flight recorder, and you can retrieve all data from these databases, even in case of emergency. Management protocols, that is the preliminary approved or pre-approved plan of treatment of foreign patients as before and after the operation, the surgery. Relevant protocols for monitoring. You must always keep in touch with patients to get their feedback. It doesn't matter if they have already left the country. You must stay in contact with them to get continuous feedback in case they have some comments and remarks to make. Relevant protocols for high standards of hygiene to get optimized treatment results. You must understand who your patients are. For example, if our patients are oncological patients with compromised immunity, they may need a more strict infection control strategy rather than immunocompetent patients. Or if a person wants to get tooth implants, they have different needs in comparison with patients with endoprothesis of shoulder joints. And it is, of course, needed to support the patient with transport logistics, visas, getting visas, translation, invoicing, and so on. And again, coming back to the topic from the previous session, our colleague mentioned that not every clinic has a specific or special department for this work. Well, as I can see from my experience, from working in one of the Swiss clinics in one of the departments. I worked in the international department, and now I work in a Turkish clinic. So there are actually international departments in such clinics, and they do provide coordination services. Both doctors and non-doctors can work in international departments in clinics, and they can be responsible for coordinating and communicating with patients. That's why it is usually an international department which is in charge of it. As for translators, premium hospitals have always accredited interpreters and translators. And the language doesn't matter. They have all possible variety of languages available. They invite a relevant interpreter every time they need it. One more thing for comparison. Compared to Swiss prices, the prices in Turkey are, of course, 30–40% lower. But I can evaluate the difference in qualities, and there was actually no difference. Turkish clinics provide high-level services. So you can see the difference, right? So as one of our colleagues mentioned, how it works in Switzerland, for example, translation services, the interpretation services, translator services are paid per hour, so they're quite high. But if a clinic with an international department provides these services are already included in the bill. Then, of course, accommodation of a patient. That's what they also can take care of. So as you can see, providing high-level services is not something we can take for granted. You must plan and think very well about how to organize this process. And please keep healthy, and thank you very much for your attention. Okay, to add to this, I would like to mention that being a doctor and occupying another role at the same time, I can say that we are ready not only to cooperate on the commercial basis, but we can also cooperate in research and education, like exchange programs. We invite students from the Russian Federation. Thank you very much, Nigar, that you drew our attention to the specifics of working with foreign tourists. That's exactly what I wanted to mention here, because we have representatives from universities here in the audience, and I'm sure that they will ask you for a business card, and you may want to think about some joint educational programs or projects. That's a very promising direction. And I'm really happy to share, because that's exactly what I'm working on. I can now see these at least one person from a university of State Service and the University of Economics. And University Turan, I wasn't sure about the name. So as you can see, at least 3 universities are present here. That's great. Thank you very much. And now I would like to give the floor, but I can't say it so, because our colleague from Iran is not here. He's online, and we will now ask our colleagues to show us a video. Navid Kizmi will speak about the cooperation between Russia and Iran and synergy of tourism and medicine. Thank you.
Aboard flight 226. Looks like we'll be a little over 2 hours en route.
Welcome to Iran!
Hello, this is Navid Kazemi, the International Business Development Manager of Nivar Travel Company. We are a tour operator, and our head office is located in Isfahan. In this video, we are going to talk about health tourism market in Iran and Russia, and our relations, which have appeared to be one of a kind recently. Tourism industry between these countries has also been very important, either in terms of visiting or hosting. And we've had such successful experiences in this area. The close commercial and business relations between Iran and Russia has always been of great importance. Recently, Russia has empowered its activities in medical tourism. On the other hand, Iran has been hosting thousands of visitors from various countries with the purpose of medical treatments, especially from Arabian countries. We are currently diagnosing problems in the health tourism market of both countries, aiming at addressing the needs of providing health tourism services in both Iran and Russia. And due to the constructive relations between the two countries, I strongly believe that the opportunities in the markets of the two can supply each other perfectly. International branding among tour operators in these two countries can also facilitate such provision, which needs spreading information or more information and awareness all around the world. After having successful cultural and sightseeing tours to Russia, Nivar Travel and Holidays in Iran is now ready to develop its market in the field of health tourism industry in Iran and Russia. I hope this is the beginning of a fantastic influence on the tourism relations of the two countries, and wish both sides great success.
Thank you very much. I would like to give the floor to our colleague from Iraq. Dr. Benjo Amini promised to tell us how he was taking tourists from Iraq to St. Petersburg. He was the first to be involved in creating this medical tourism sector in St. Petersburg. He will zoom in on relations between the countries and with St. Petersburg in particular. The floor is yours. Thank you. Dear friends, let me welcome you here from Mesopotamia, from Iraq, one of the centers of ancient civilizations, and from the sunny Kurdistan region. First of all, first and foremost, I would like to ponder upon our company, RKP Company. That's its name. I set it up so as to make a bridge between Iraq and Iraqi Kurdistan and Russia on the other side, in all areas: tourism, trade, cultural relations, and so forth. Speaking about the company, I'd like to say that it was among the first to initiate trade and tourism, rather, in particular tourism with Russia, a long time ago, when no one even knew what medical tourism is. In Soviet times, I entered Baku University in Azerbaijan, and I'm very grateful to this wonderful country and its amazing people who welcomed me really cordially. I received a very hearty welcome and obtained very good education and learned wonderful language. Actually, I learned too, both Russian and Azerbaijani. Thank you very much. I would like to send my gratitude, extend my gratitude and welcoming words to that university. So, I had a degree in medical education, and I learned that Russia has enormous scientific and practical potential. And I lived for long in Baku, Azerbaijan, and in Russia, and I built up good links with representatives of different clinics and institutions, including Department of Healthcare. At first, I wanted to create a Russian clinic in my native country, but we found out that this project has to come to life at some point. You must know that Iraq is one of the wealthiest countries across the globe, but it was affected by many turbulences for quite lengthy time spans. Our education system is very solid, but after Saddam Hussein's demise, different happenings in south and in northern areas of the country. There have been different movements and there are areas that are very ancient and that were left damaged by the turbulent period, but right now they are very safe areas, and I can invite you to Erbil, for example, which is one of the safest cities in the world. There are many sites worth seeing there. Thank you. We will try to organize a tour. Thank you. Thank you. First, people from clinics will come to this city, Erbil. So, Baghdad and other cities send people to us. We have cutting-edge technologies and hospitals, private and public hospitals. People come for treatment to us, and we help patients. In 2014, my company was incorporated, was registered. I set out to work at that time, and I was actually encouraged to make advertising, to do advertising campaigns, but I decided not to do that because I knew that people had lost trust in many other companies, and they wouldn't believe in our activities. They would see us as some sort of fraudsters. So for 4 years, I kept working, and actually, within a short period of time, a staff of 5 or 6 people were not enough, were already not enough to cope with all the paperwork. We would also send patients to Russia. We dealt with visa issues. So that's what I did. We gained some solid reputation within 4 years. Here you may see a picture from one of the most recognized hotels in Iraq, representatives of public domains, business sectors, and medicine all gathered together to see the presentation of the company. All the TV channels were broadcasting this event. As a result, the whole country got to know about us. You may see that very influential, high-ranking officials were present, and we were acknowledged by the Consul General of Russia, who extended gratitude on behalf of all the participants of this event. So, why did I opt for Russia? Why did we go to Russia? As I've already mentioned, I studied at a Soviet university, one of the former Soviet states, and I came to a conclusion that Russia has an enormous potential and has built up enormous experience. So compared to some other countries, I could see that many people could actually afford to come to Russia and get treated there. Another factor was the geographical location, very favorable logistical position of Russia. People could easily go there through Turkey, through Qatar. So far, we haven't had direct flights, but our governments are working, and private companies, as far as I know, are taking steps so as to set up these direct flights. Iraq and Kurdistan have had relationships with Russia for centuries in all sorts of fields, cultural ties, historical ties. Many people love Russia in Iraq. If Russians come to Iraq, anyone will be glad to welcome them at their home. Thank you very much. For 8 years, our company, RKP, has sent more than 1,000 patients to Russia from Iraq and Iraqi Kurdistan for healthcare services and for restoring health. And we gave this opportunity to these tourists. Can you hear me? Yes. As far as areas covered by our medical tourism services are concerned, here I would mention some like ophthalmology, which is at the top of the list. And according to our statistics, up to 80% of patients come to receive some ophthalmologic treatment, and there are offices across Russia, and Tambov branch office is actually one of the most active in providing medical services to our patients. Thanks very much to this branch in Tambov. When some time ago I came there, I got to know its representative, who is still supporting me and has been supporting me and has always been very good to me. Other areas include traumatology, cardiology, plastic surgery, and general surgery. Speaking about myths and realities of getting medical treatment in Russia and abroad, I would like to read out some passage from this slide.
So,
what is worth mentioning is that in Germany, according to a lawyer whose name is Tatiana, in Germany, so as to get to an ENT doctor, to an otolaryngologist, she would have to wait for 3 months to get a set appointment. As a result, she was indicated as surgery, but to get the surgery done, she would have to wait for some more months. She also pointed out that in Krasnodar, on the opposite, this surgery was done in a medical center in Russia on the very next day after she came there. So, a quote, in Russia, most people are convinced that in the West, healthcare is quite good by quality and by its organization. But in reality, many people are disillusioned and ignore the fact that not everything is better than there than here in Russia, end of quote. I would also like to remind you of a federal project entitled The Development of Healthcare Service Expert, launched in 2019. This project had a goal of scaling up the volume of medical services exported from Stavropol region, Stavropol Krai, by at least 4 times compared to 2017. This was supposed to be done by raising the number of foreign nationals treated up to 1,120,000 people by 2024. This information has been borrowed from the website of the Ministry of Health of Russia. As we know, the support at the federal level is quite considerable, thanks to the president, but still there are some challenges we have to face. I can say that, as Evgeny knows, in Moscow we are waiting for some problems to be coped with. Such problems include situations when really severe patients with severe symptoms have to wait in the airports for many hours. Another point is that Russian clinics find it quite hard to make formal invitations for tourists due to illegal migrants and to penalties. Penalties are quite high if, for example, if a patient comes here and gets deceived. So I can see the good reason behind this principle. And regrettably, there are some fraudulent sectors, and this inflicts a really bad reputation consequences on the market of medical services. And I'm very proud that in our history there have been no violations. Dear friends, if we come to the prospects and difficulties Here I would mention that the Russian president has given an instruction to launch a national project to support health tourism, and our team is well prepared for increased number of patients. Which difficulties can we mention here? First of all, very long time when patients are kept waiting for 3 or 4 hours on the airport premises. And it has actually happened to us when patients would call me and tell me that they had to wait for so long. I don't think they deserve this. Of course, we can say that Russia is concerned about people illegally coming here. So that is why Russia is cautious, and this approach is justified. But I think that a company like RPK, which has been active for so many years in Russia, I think that it has to be given some trust, and we can provide some guarantees on our side that we will not let any violations happen. Our statistics hazard that 90% of patients have been to local healthcare facilities in Iraq. Then they have been to some other countries. I would not like to mention any names here. But in the end, they didn't get the result they wanted. They didn't get treated. After that, they came back to us and were forwarded to Russia, after which they eventually sorted their health problems. I've already mentioned that medical tourism still has some ground for fraud. We observe illegal companies which also offer services. We know cases when illegal migrants would come to Russia even without visiting, even without attending healthcare institutions. They would actually end up in the hands of illegal companies, fraudulent companies. RKP is fully aware of this, and therefore we check the medical history of each patient, their medical records, on a personalized basis. We carry out an interview with every one of them, which is a prerequisite for sending to Russia those patients who are actually in need of healthcare services. How do we make sure that our tourists go to Russia legally? By means of a personal interview, by means of checking health records. If there is at least some suspicion, we call the medical center and ask them for some proof that this person has been checked by them. Moreover, we require people to provide documents concerning their permanent residence, and we sign a contract which puts forward some liability clauses concerning financial and criminal liability for violating the law. So these are the filters we use to screen out our customers, our clients. Now, let's mention the COVID-19 pandemic and fight against terrorism. As you may know, this fight against terrorism has actually cost a lot. It has cost us huge amounts of resources. But after this period of combating terrorism, we resumed our work, and then the COVID-19 pandemic happened, which did not let us send our tourists here to Russia. In 2021, demand for health tourism to Russia has gone upward again, and it is ever increasing in Iraq and Iraqi Kurdistan. Positive experience of high quality and cheap treatment also affects this increased demand for medical tourism in Russia. Therefore, the number of patients who choose medicine for treatment in Russia is on the rise every year. The question is whether there is war in Russia or not. We know what happened in 2022, and people think sometimes that the situation is really turbulent here in Russia, and that is why at first all the ticket prices rose 4 to 5 times. So we had to spend some time trying to convince people that everything is fine here, it's safe. So price tickets could go as high as 3,000 from 500. Due to our pooled efforts, we did some awareness work so as to raise people's awareness and to explain to them that it's quite safe in Russia and everything is under control so that they could come here. Over the recent months, we could see an upward trend, and a group of tourists came to Russia, and a group is coming on Sunday. Monday morning, they will already be in Moscow. As for our indicators for 1 month in 2023, since the special military operation was announced, there has been a decrease in the inflow of patients from Iraq to Russia who had to delay their trips. But over the recent months, there has been a surging number of people willing to come to Russia for treatment. How do we work with our patients? First and foremost, we assess our patients so as to screen out those who are in real need of help. We collect medical records, documents, we conclude an agreement with the patient, we obtain a visa, then we send a request and get an invitation from a Russian clinic, then we sign a contract with the patient's representative concerning safety-related responsibility. And we have translators and interpreters who are trained so as to accompany patients to speak using their local language. So they accompany them 24/7 throughout their stay in Russia. To wrap up, I would say that our mission is to provide patients in the health tourism market with the supreme quality of medical services in Russia. We take great pride in cooperation with Russian professionals and are ready for continuing collaboration for the good of patients and their health. Thank you.
Thank you very much, Dr. Amini. Interesting presentation indeed. And actually, we recalled that St. Petersburg with some clinics in St. Petersburg, like Fedorov Clinic, was one of the first to host foreign tourists. So nobody talked about medical tourism that time, back then, but the tourism existed. But now it is developing very rapidly, of course. And we saw about 79,000 medical tourists here in St. Petersburg, and the services are worth 470 million rubles. So, we face growing tempos of development, and we are really glad that you bring students to Russia, and we would like to host them here in St. Petersburg, not only in Tambov. While one remark from me, you may wish to consider a cooperation with local medical tourism agencies so that they can help you here on place. As the colleagues mentioned before, it's not exactly the business of a clinic or hospital to follow what's going on with a tourist, with a client. So you may want to consider some collaboration with tour operators in St. Petersburg. For example, we have an agency of medical tourism here in St. Petersburg. So I wanted to point out one thing additionally. By the way, we are developing everything, obtaining experience. Well, first, what I want to do here, first, we want to provide our clients with a cultural program after their treatment has been completed, so that they come home in a very good mood. Well, second, we are now negotiating with several hospitals. And the goal is to host people here in our country. Well, some hospitals are a bit cautious, but many hospitals, which we have been long cooperating with, they are ready to do so. First, we wanted to see it as kind of a charity, our goodwill gesture, like to come to us and work with orphans or vulnerable people or people suffered in their fight with ISIS, and then they could then come again. And well, I know, right, checkups, all these steps that we can negotiate with you, discuss and consider, and we will be moving in this direction, increasing the tourist flow. The medical tourist flow. Thank you very much. Thank you, the distinguished speakers, and thank you all. We are really thankful for being with us. The audience may have some questions. Thank you very much for participating in this expert medical health forum. We will be glad to see you at the reception at 6 p.m. There were some problems with the mic. Well, and I think that our working session can be considered closed. We can take a group photo with the speakers, and then you will have some free time to enjoy, and we will be glad to see you all at the reception at 6 p.m. Thank you very much.